affordability measure for our enrollees. So a year ago, we talked about wanting to make sure that we were communicating to enrollees. We were the first state-based marketplaces, well, really any marketplace, to communicate to our enrollees that a change was coming. And we do think that was successful in helping people understand what was coming and potentially help us retain some of our existing enrollees. And, as we continue throughout the summer with the federal changes in the One Big Beautiful Bill, HR1, and continuing the conversations around affordability and enhanced tax credits. I think we all kind of know the story now that there were a lot of ups and downs throughout open enrollment, the government shutdown, including whether to extend the tax credits or not. And we are now coming out of our open enrollment period where the enhanced tax credits were not extended. Costs did go up for consumers significantly. And so we'll talk today about kind of the outcomes we saw from that. And really that the past year is going to also shape the next couple of years for us with those federal changes. So at a high level, that's really what we're going to focus on, first half of the meeting today, doing a look back at our strategic initiatives over the past year, and then looking forward in the second half of the meeting towards what we're planning over the next year or two. So as we know, the enhanced premium tax credits did unfortunately expire despite kind of numerous attempts and some bipartisan efforts to extend them. They were not extended, and so those costs did go up for our consumers. We really saw high public engagement on this issue. We saw a lot of significant media interest from both in the national conversation, but more specifically across Pennsylvania. What we heard is that there were a lot of people who were reading stories on this, wanting more information on healthcare affordability and what was happening. So we really saw a high level of public engagement, including enrollee engagement in terms of the traffic we saw on our website and our call center, which we'll talk about a little bit later as well. The other piece that we'll talk more about, but just to say from the beginning, is that we're really at a point in time in terms of the enrollment numbers. In the past couple of years with enhanced tax credits, where we've ended at open enrollment has fluctuated a little bit throughout the non-open enrollment period, the 18 months. But that is not going to be the case this year. We are expecting sort of significant changes, and in fact are already seeing some of those in the first 2 weeks since open enrollment closed. So we are going to continue to have that analysis ongoing, those impacts sort of coming to fruition over the coming months. And then, the federal rules continue to change and to impact what we have planned for the next couple of years. So there was recently a federal proposed rule issued last week, very recently, 30-day comment period. So we'll talk about that as well during this meeting. But again, just continued monitoring of both our enrollment trends over the next coming months and the federal rules that have come out and may come out.
Sure. Devin, just before we move on too much farther, I think just a really compliment to Pennie and the team for the pennie.com/affordability site was, I think, among the best that I've seen states display to explain the impact of what it means for consumers. And that's not only states, exchanges, but that's the Kaiser Foundation and others. I think the Pennie site provided more information to more people. It was particularly helpful for those of us that had conversations with congressmen about what it means specifically for that district. Because if you hadn't been able to visit the site, you were able to drill down by district and the average premium impact, the number of people impacted. So I think it moved the conversation quite a bit. Obviously, we didn't get where we had hoped, but I think it wasn't because we weren't prepared, and I thought you all did it. So kudos to the team.
Yeah, thank you for that. And it was in no small effort to keep that updated and continuing to look at that data. So credit to the data team and the strategic planning partnerships team and our external affairs team, and really just the collective effort to continue looking for data that we thought would be helpful in telling the full impact. So full credit goes to the team on being able to keep that data updated and refreshed. Thank you.
We'll just roll right into open enrollment, I think.
Yes. All right. So we are going to talk about this first part, what the outcomes for open enrollment were. So going a little bit of a deep dive here. So we did, and this was included in our press release that some of you may have seen, but just to talk a little bit about it here. So we did see new enrollments coming in this open enrollment. However, we did lose pace when we compare those new enrollments to prior years. So our new enrollments, people coming in for the time, were down by about 12%. But And so we ended about 2% lower. So if you may recall, last year, we were not really sure what to project, given that this was an unprecedented cost increase for an open enrollment period. So in our worst case scenarios, we were really going down during open enrollment into the low 400s. We didn't see that happen because we saw new enrollment kind of backfilling the people who were dropping coverage. And so that was good for now. But again, we're sort of at a point in time and need to continue to monitor. We did see, and we really saw that new enrollment as a continued demand for high quality coverage. People are still looking when they don't have other options for coverage that they can find that they know will cover everything they need. And for those who are still eligible, be at a reduced cost. However, the main story that we really are trying to make sure does not get lost in that overall number is the loss of coverage and the high number of people who drop. So we ended open enrollment with about 85,000 people who had dropped coverage. That continues to increase every day. As of this morning, we are over 102,000 people who've dropped coverage. So, that's about 17,000 people in 18 days. So, at times during open enrollment, we were seeing a pace of about 1,000 people dropping coverage every day. And unfortunately, we are continuing to see that. The difference being that we no longer have new enrollments backfilling that because open enrollment is now closed. So while we ended open enrollment at about 486,000, that's 10,000 lower than last year, we are now down to about 471,000. And we do expect that to continue to drop as we continue to see people not being able to afford the coverage and not having the backfill that we would normally have from open enrollment. So we are on the pennie.com/affordability website, we are planning to continue to update as we kind of hit milestone numbers there. So we are planning to update now that we're over 100,000. Just with that information, we'll continue to keep that web page updated throughout the next couple of months as we continue to see people dropping coverage. Another key component is that we did see people buy down, shift to really in search of finding premiums that they could afford on a monthly basis, now that the premiums were going up without the enhanced tax credits. So we have about 30% more people in bronze than we did last year. That's about 33,000 individuals. And, as we all know, those do achieve the purpose of having a monthly premium that's lower, but that people can fit into their household budgets. However, they do often need thousands of dollars more in out-of-pocket costs, deductibles, co-pays, et cetera. And research has demonstrated that those cost barriers can cause people to delay care, not seek care. And so, I think while they are still covered and that is good, we are concerned about sort of the impact on them being able to maintain health with that coverage.
But we don't have a good ability to track where cancel coverage go, right?
We don't. So we did do some surveys of people who newly enrolled and people who dropped. For people who newly enrolled, what's interesting is most of them were coming from other coverage. Only about a quarter were coming from the uninsured. So we didn't feel like we were drawing a ton in from the uninsured ranks. It was more like people moving off of COBRA or their employer coverage ending. On the people who dropped coverage, most of them did not drop for other coverage. The reason they provided was that the cost was too expensive. They might end up finding something through some of the other, less regulated, obviously those types of things that many of them were dropping, not because they had other coverage, but because they could no longer afford to stay on.
Yes, question. Yep. The new enrollees, are you seeing a different pattern than from previous years? Whether geography or topography?
Not much of a difference. We continue to draw a lot from lower income individuals. So we lost a lot of lower income individuals, but that's also the group that enrolled, just because we continue to see that the majority of our really speaking to just, a 30,000 budget is not the same for everyone. Some people can fit insurance into that and some people at the same income cannot. I think it speaks more to the pie is smaller now with people who are able to afford coverage.
Other questions for Devin?
So this is just a depiction of our trends overall. You see the enhanced tax credits were put in place. We saw a steady increase without the enhanced tax credits in results this year. But again, it's going to be a little bit different. That number is going to continue to go down throughout the year. Next slide. But this shows that I think one thing to pull out, a lot of sort of similar numbers here, but one thing to pull out is that one of our goals was to have people come in more actively to shop. We knew with the price changes, a lot of times in past years, people sort of passively rolled from one year to the next without making a plan change. One of our goals was to make sure people came in and looked at all their options so that they didn't just drop coverage, they actually looked to see if something else could fit into their household budget. So it's good to see that number higher. And also, we had talked about with pre-enrollment verification coming up next year, we wanted to get people in the practice of coming in every single open enrollment. So we have another stat later on about that. But we were encouraged to see that more people were coming in, looking for different plan options and hopefully updating all of their information as well. Next slide. So we have this chart and the next chart really talk about enrollment by county and then percent by county. I think as expected, the higher numbers by volume are more in the urban areas, and the lower numbers tend to be in the middle and northern parts of the state. And on the next slide, this is really the percentage of enrollments. So we see some positives. In some parts of the state, there's some lighter colors, and then the darker colors are more of the negative as we shift into negative enrollments. And, we had put a map on our affordability webpage of sort of where we expected the biggest price increases to be in Julietta and Fulton County. And we are, what we see here is a pretty similar pattern of sort of where it's darker, kind of lining up to where some of those bigger increases were. And this breaks that down a little bit more by rating area. And you can see the red, the Cambria rating area 5, and housed a couple of those counties that had the most significant premium increases. And that is where we saw the most significant drop. But this also really does speak to the variability based on region and geography. We saw a lot of variation in the impact of the enhanced firing by region. And this really demonstrates that variability kind of played out differently in terms of enrollment across Pennsylvania.
That those trends could, sorry, it's Colleen. Do we think that these trends though with payment rates, like I don't know what your indication is of payment rates by region to understand what ultimate disenrollments could. You could see in the more urban, people just biding their time, and then ultimately you could see bigger hits to some areas after the 90-day grace.
Yeah, so the fluctuations we have not looked at by region for new enrollments. So I think that's a good question that we can look at that. And then on the whether people stop paying and enter that 90-day grace period, we don't have a lot of insight into that yet. We do have some questions out to the insurers about anecdotally what you're all seeing. So for those of you who've been looked at that, we're just trying to get a might see coming in April. So it's hard to tell because we're not able to see who's sort of entered that grace period. When we do, I think it's a good point to analyze that by geography and rating area.
Ellen, just wanted to add, I think one of the things that we maybe didn't anticipate changing was as people have lost eligibility for subsidies, the grace period has changed for some members, whether that is still 90 days or not. So I think just to be aware of that curve might be a little bit front loaded compared to prior years. So something we're starting to dig into, and people that may have had 90 days in the past, if they no longer qualify for the same level of certainty, may not have that same 90-day grace period.
Yeah, that's a great point. And we did see the number of people paying full price who would only have typically a 30-day grace period, go from about 50,000 to 90,000. So I think we potentially will see a bump this month. And maybe that's some of what we're seeing, and the continued high rate of people losing coverage. And then perhaps another one in April. Great point.
Other questions?
So we want to talk about some of the shifts in type of coverage as well. So I talked about the bronze plan, and that we did see an increase from 23% to 30% who are enrolled in bronze. We also looked at catastrophic, and people might recall in September, the federal government put out guidance saying that broadening the hardship exemption, that would really allow anyone to qualify for hardship exemption and be able to see catastrophic plans, which are generally either for people under 30 or for the hardship exemption. So we're one of the states that uses the federal government's exemption number process. So people had to, submit the federal government for an exemption. They received exemption number, they put that into Pennie, and then do catastrophic plans. I think we weren't really sure what would come of that because it was a relatively late change, and oftentimes catastrophic plans, since you cannot get enhanced tax credits on them, don't end up looking that much appealing to consumers. We did see a drop in catastrophic by about half. So we were about 1,100 last year, and now we're about 470. I think part of that could also be, and we haven't dug into this more deeply, but we did see a lot of young people drop in coverage, especially in the Philadelphia area. Young people who are below 30, might be more prone to enroll in catastrophic. So, I think there could be a couple things going on here. But the one thing that did stand out is that it did not increase our enrollment in catastrophic, even with, the guidance sort of indicated that this would really help with affordability. But I think what we saw is that it didn't make much of an impact on affordability for consumers.
Sure. You know if that is true in other states by any chance? Yeah. I wonder if that trend was across the board.
We don't know yet. FEMA's typically puts out plan level data, but not until the March or April timeline, and that's for both the federal exchange and states. So I think we would know then, but we don't have it at this point. But we can. That's a good question. Yeah, let me have that data.
This will come up again when we talk about the for next year, because again, we obviously try to move people to catastrophic plans instead of possible. Based on our data so far, every area of Pennsylvania had access to a cat plan, but very few thought it was cost conscious decision that they wanted.
Could be fine.
All right, so we also did see quite a lot of activity on our call center front. So we had the highest single call day volume ever in November, on November 3rd. That was sort of the first Monday of open enrollment. It's usually our busiest day. But that was notable in that it was the highest call volume that we've ever had in a November. And
Actually, Devin,
Yeah.
let me go back for 1 second, just because I don't want to stall there. On the auto enrollment piece, do we know how many people, I know the auto enroll number stayed pretty high, but do we know how many of them at least logged into Pennie? So maybe they didn't shop, but how many of them looked like we want them to start?
yeah, and that's on a later slide. I believe it's
Okay.
60%, and it was I'll give you the slide, but it's higher than it was last year. So
Yeah.
I think it was 50% last year.
We can get there.
Yeah,
No problem.
but we did see it.
Positive.
Yeah.
Okay, sorry.
Yeah.
Circle back to the call center.
And then we did also see one of our other highest days on December 15th. That's the deadline for January 1st coverage. Usually, as we know, we did extend that time frame, but we didn't communicate that broadly to consumers until right around that December 15th date, to really just try to make sure we got as many people in mid-month as possible, so cars can get out and if there were any issues, they'd have time to work them out. We still saw, very high call volumes on that day. We talked about in December that because of all these high call volumes, we did see some challenges at the call center side of things with insufficient staffing that led to long wait times. We did really push to remediate that. And after starting in mid-December, we were able to really turn around that in terms of we had a very proactive callback and resolution effort where we would reach out to people and try to call everyone who had called in. And then because we were able to add more people to our staffing, the speed to answer dropped significantly. We were really kind of pacing more to where we had a consumer experience from past years of second wait times instead of multiple minutes. So the second half of open enrollment looked much better from a consumer experience perspective on the call center.
We don't have an ability to track how many of those abandoned calls ended up with secured coverage, do we? Some of them would already be Pennie members, I assume.
Yeah, Jim or Rob, if you guys know the answer.
So we don't know that number right now, but we could look at, because we do have every household that we had to call through a program called Pairs that we instituted to make sure that the contact people in, so we could run that in circle.
And I would just point out as well, we're classifying that, campaigns a 35% connection rate, folks, but 27% of those connections were successful, which is about over 5,000 of those folks had what we're referring to as positive outcomes.
Okay.
So as far as securing coverage, maintaining coverage, we can dig into that a little bit more. So we do have better numbers on that.
Other questions on the call center?
I'm just curious, do we know what the data look like for that last days of open enrollment? I'm just curious because we extended it, right? Usually people wait till the last minute. Did we see that or did that not happen as much?
It was not as dramatic perhaps as it's been in the past. So 131 and 1231, not tremendous spikes, but we did see, especially late December, a higher volume between 1216 and 1231. Folks trying to get those 1/1 coverage dates than we've seen previously for the 2/1 start.
And most of that was, if I'm not wrong, in sort of the last 3 days, like after Christmas, before New Year's, just squeeze it in. Okay. And then on the next slide, talking about our marketing impacts. This really goes to the last couple of open enrollments. If you may recall, we've taken targeted approaches to address specific issues we're seeing. So for example, in open enrollment 2024, we had seen the Philadelphia area sort of losing pace with the rest of the state with the unwinding enrollments. We weren't seeing as many people kind of pick those up and enroll. So we had targeted that area. Last year, we broadened that a little bit to the Pittsburgh region and more Eastern PA counties. And then this year, under our 3-year uninsured plan, we had broadened that as well. And this really shows that our efforts are successful when we do target marketing on specific areas. We are able to kind of lift enrollment in those areas compared to the overall. So you can see the statewide average growth there. And then on the right-hand column, the areas targeted outpacing that statewide average to varying extents, some in very significant ways and others to lesser degrees, but sort of all being above that statewide average. Keep this one in mind when we talk about marketing for next year. Any questions on this? And this talks about that as well, really just how we were able to drive website traffic from our marketing. In particular, we also track that specifically from Philadelphia. We're seeing some slower pacing there, so we put a little more attention there and got some reaction to that from consumers. And again, just underscoring that when we prioritize our attention on an area, we are able to get a reaction. Chachi, anything you'd add?
In case there's any questions. Questions?
Guess on some of these new enrollments, Colleen, sorry. I'd be interested just to see with the enrollments that we're getting this year with the significant hit from a financial perspective to people, do they actually maintain coverage for as long as previous enrollees, right? Like, are we seeing them just get coverage, get what they need done, and then drop coverage or stop paying? Like, do we see non-payment rates for new enrollees consistent with previous years, or do we see different behavior patterns?
Yeah, and one of the successes of the enhanced tax credits is that we did see more maintained enrollment, or the numbers during the SEP period really stayed last year. They just continue to fluctuate between 485 and 495 pretty much all year. We didn't see big drops in the first few years of the program before the enhanced tax credits. We would see bigger drops. And so it does, at least if the last 2 weeks are any indication, we are sort of returning to that prior state of seeing bigger drops and sort of continue dropping throughout the year as people may struggle to maintain coverage or, making, just as things change, making choices about whether they can maintain it for the rest of the year. So as the year goes, we will definitely be trying.
This is Antoinette. I would add, I'd like to follow the bronze plans folks, because I think we're seeing an increase in that. And I think we often see folks come back to us and say, oh, I didn't realize when I signed up, this happened. Like, I have a deductible, I'm not interested in coverage anymore, so I think it would be interesting to follow that group to see what it is to them. And if we can do any kind of additional surveys that might be helpful, like medical debt, did they delay care, stuff like that. I think as we see more people shift towards that, it's important to understand that data.
Noted that, yeah, those are good things and we'll follow up on this series. So this slide, you may recall, these were sort of our targets that we outlined for ourselves in August going into open enrollment. So we wanted to, even with all the federal changes, really try to, maybe adjust our expectations for prior years, but still kind of have goals of what you're looking to do. So initially we were still able to auto renew a lot of people. We did have higher rates of active shoppers, as we see in that second line. We wanted to try to have that be above 30%. And we did hit that at 33%. That is, about 10% higher than the prior 2 years. We also wanted to make sure that for people who were not able to be auto renewed, that we were able to try to get them back. So we hit that mark as well. We wanted to try to keep the impact from high premium increases below 30%. And so, came in about 17% from that. Effectuation rates right now are still pretty high, which I think we were a little bit surprised about. I think we were expecting to see more of a drop there. I think it does get to the question of can they maintain it and for how long? But at least for new enrollees who are initiating their coverage for the first time, at this point, we have seen pretty similar effectuation rates. And, it would be interesting from the insurers if you guys are seeing anything different on your ends. But that so far is what we see for those new enrollees.
We're seeing consistent new enrolling payment rates, consistent with what we've seen historically. So it's the other side of the coin. It's not as good.
Yeah, the existing. And then this gets to your question, Commissioner, on the logins. So we look at active shoppers, but we also last year started looking at, sometimes people come in and they look and they say everything's good and they don't actually need to make an update or need to make a change. We wanted to capture that activity as well, just to have an understanding of how many people are just logging into their account every open enrollment. Because again, when we have to implement pre-enrollment verification, we're going to need 100% of people doing something every year. And so we're trying to get people in the practice of doing that. So this was at 49% last year, which was the first year we were tracking that. And we wanted to be above 60 and we were at 62%. So that means about 62% of our existing enrollees did come in to do something. It might mean they didn't change anything, but that's okay as long as they were logging in. We really just wanted to see that engagement, that they could come to their account and review what they had.
This is Colleen. Did you see any patterns in the 40% who did nothing, like age group, demographic, geographic, like anything? Not perspective.
Not looked at that, so we can look at that and circle back with data on the completely inactive.
But if we have to message to people in the future, it may be helpful in understanding the best ways to reach if they do fall into certain demographic categories or something.
I was video element for that. How early can someone verify 2027?
It's a good question that I think we need guidance from CMS on. I think the law is stated, says that we have to make it available starting August 1st, 2027. There is some discussion amongst, some other state exchanges of whether that's when it has to start, but is it possible to allow people to do that before that? So unclear in this.
Because I think piggybacking on Colleen, I think if there's an opportunity to go out sooner, like last year, we were the first state to go out with postcards, and I think that was pretty successful. I wonder if there's a way to do something mid-year-ish, kind of driving home the point that we're really going to have to come in this year, or else risk losing.
Yeah, and I think initially we want to take those best practices that we've used to do early and often. I think we saw a lot of good outcomes from that. And we'll talk about this a little bit later with the lack of any clarity in this proposed rule, but we really there are some really key questions that we need federal guidance on. I think we can plan with our own understanding, but really need some of that.
Did I see a hand over here?
No, it's a similar vein of questions. I think the people who enrolled but didn't actively shop make a decision. I would be curious to see how many ultimately paid, and I'm thinking like running those metrics in the April-May timeframe. There might be an opportunity to re-engage people who came to the website and then did not take kind of formal action. Or we might find that they were all satisfied and we don't have to reinforce, but I don't know if there is an opportunity that were people disappointed when they saw the rates and left. Or what the next best action may be to help keep them engaged in the process.
Just Colleen, again, just to piggyback off what the commissioner was saying, that population that hasn't done anything, I like the proactive approach because some of these people may have no idea what their login is or their password is. Like, if we don't want to get crushed in the call center day one, how do we kind of stem some of that, urgency right at open enrollment with getting people prepared, make sure you can log in and do it. So they may not be able to even verify at that point, but like, make sure you can log in, think that type of messaging so that they are prepared when the time comes might be helpful.
Yeah, it's really going to be a very different paradigm completely because we have open enrollment, which is typically when everyone starts. And that, would be if the proposal gets, confirmed October 15th. And then if you have August 1st, like there's this pre-window, it's almost like, I think of it like when you're buying a home, like get your pre-approval for a mortgage before you actually find the home. It's like almost like that, but it's going to be a very different consumer behavior. We're going to have to try to get them to come in twice, just to update their information and then to pick a plan if they don't want what they have. And I think it's going to be just across the board a very different paradigm.
And also are we going to be tracking who's not taking action so that they understand they're going to lose coverage? If they have, like, at what point are we kind of drawing a line, like hitting the panic button for these people a little bit to be like, hey, if you don't do something, but you have to give them enough time to then be able to react. I think that's the other challenge, especially as we look at the timing of when open enrollment will run.
Other questions, feedback?
Now, we have one more open enrollment to try to get that 60% higher. So we're gonna try to, this open enrollment, I think really push to try to get that in. We'll set our goals, but really try to even get another big chunk of that to get people in the practice before it really has the consequence of not being able to continue coverage or have tax credits.
Sorry, and what are the dates of that next one?
So that's what we need to decide because we need to change.
Oh,
those.
is it?
Yeah. Yeah, so we will change it and then assuming it's the same for next year, but we'll have to kind of rework all these new timelines because there's a new federal provision that says people have to come in and they have to update something in order to get renewed. Any other questions?
We have just bring up one silver lining, and I'm not sure if this is the appropriate time, but something to flag for these Pennsylvanians who are finding affordability difficult. We passed the Working Pennsylvanians tax credit that is targeted, I would imagine, at individuals who are in this gray zone that very well may draw coverage. If we have a way to communicate to those individuals, if they're not covered, you're getting up to $800 in your pocket related to that refundable tax credit that may allow you to some financial obligations here. I don't think it's perfect by any stretch. And I know we'll talk about the subsidy wrap and other things, but that is something that's already there. This population, right? I know we'll talk about it and I don't know. If
Yeah.
there's any-
Yeah, I mean, I think, and that takes place with this tax season right now.
Yeah.
Because we do have half to penny, which is if someone says on their state tax form that they're uninsured, it does open a window for them to enroll. So maybe there's something we can do on a communication.
Already happening.
Specifically though with the tax credit.
Specifically requires it.
Good.
Tell us more about that.
We're already on. David and I talked with our partners over at Department of Revenue. So updating our 1095A landing page, getting an email out to our Pennie enrollees that fall into that income range. So we've been And then partnering on social media posts and boosting that kind of stuff too. So we've already been in contact with them.
Yeah, and I think it'll be interesting to see because our volume in the past on that has been not very high. And so I think it'll be interesting to see, especially on that income range that's impacted by the new tax credit, if we see an increase there. I mean, there's a lot going on this year, but I think it'll be interesting to look at whether we see any. Right. There. So I wanted to talk about that sort of the overall enrollment side. I wanted to talk specifically about the 85, well, now 102,000 people who drop coverage. And just the trends that we're seeing there. Just a couple of things to really point out are that it tends to be the lower income, just above Medicaid, that 150 to 200. I think when we were going into this, we were saying we expect it to be lower income individuals who are extremely price sensitive, whose budgets are already stretched thin and are not able to necessarily accommodate, a doubling of what they're paying every month for health insurance. And that did sort of bear out in those lower income terminations being higher. And then also the other side that we were concerned about were the people losing tax credits altogether because they are now above the income cliff of $63,000. There's a lot of overlap of that income cliff group and 55 to 64-year-olds, sort of the early retirees. And so we did see a large chunk of a lot of terminations among that older pre-Medicare group. As we've talked about before, that's particularly concerning because that age group, that's when health conditions can and do emerge, and sort of not having coverage during that time can cause people to miss early cancer diagnoses, not manage chronic conditions, potentially hitting Medicare with really significant pent-up healthcare demand. And so just sort of this concept of like, people are not going to get sick because they don't have health insurance. And, as a collective, like we will see the impact of that either through Medicare or uninsured or other impacts. The second highest group that from age that dropped were the young adults, also one of the groups that we were anticipating would have that behavior. And if all these groups that we had, seen increases in enrollment over the past couple of years. And, of course, the implication for the younger group being that they help balance out the risk pool if they're dropping coverage. That's not from the stability perspective. And on the next slide, we talk about also the regional aspect of this. With the enhanced tax credits, we'd always seen a lower rate of insurance in rural populations. And with the enhanced tax credits, we did see disproportionately more enrollment in rural areas. So we were able to kind of, make up ground in rural enrollment. And we saw a backsliding in that as well. 15 of the top 20 counties with the highest proportionate disenrollment rates were rural. And I think, as everyone in this room probably knows better than me, like there's just a lot of strains on the rural healthcare system already. Even marginal differences in uninsured rates can, that's when we talk with the Pennsylvania Hospital Association, that's what they're worried about with other providers. Like even marginal changes in uninsured rates can really financially take a strained hospital and make that worse. So again, those impacts will play out over time, but I think that was what we were anticipating, and unfortunately what we ended up seeing with rural disenrollment.
Can I ask a question about previous slide? Sorry, I suspect both of you. I noticed that there's almost 9,000 children disenrolled by age. Do we know if any of those kids got enrolled in CHIP? Or
look, we don't know that right now, but we can see what.
Or at least we gave them information about CHIP as an option.
And we do, and we also did some more proactive trying to make sure that people were looking at all their options, so we can see with that.
I mean, for children, more options than for adults, so.
Yeah.
This is Amy. Since you mentioned the CHIP, and this is not where we. Did you track any numbers about young people, like people under 19 who were transferred to Medicaid or CHIP as opposed to being terminated?
So we, I know we looked at overall who we sent to Medicaid and CHIP. So Rob, I don't know if we got to the granularity of
to that question.
So we actually are still underway in some of this analysis. Because basically, we pulled all of our data for all the transfers that we sent over to DHS for Medicaid and CHIP, and who was rejected or who was accepted. Next step that we're currently working on is communicating with DHS to try to get an active role, who's actually currently involved. So Dr. Buckingham, I'll answer your question, and speak to some question. But it's basically, we're trying to figure out who stayed with CHIP versus who didn't. What rationale for why they.
And so you're looking at it in age bands as well.
Yes.
For all the-
Once we get the return file, we already have it fixed, so we can easily think up by ages, whatever you need to verify.
That'd be good to see. Thank you.
Can I ask one more question? Sorry,
Yeah.
going back to the previous slide. What is this group 0 to 100%? There's 7,000 that terminated. Are those immigrants? Like what is that population?
So one of the changes coming in this year were that people who were under the 5-year bar threshold, they have not had their lawful immigration status for 5 years yet, so they didn't qualify for Medicaid. Still get tax credits through Pennie. HR1 removed that eligibility, so people at those very low income rates have to pay full price. So we do, that is a lot of that.
Okay.
And just back to the mitigation point. So on the lowest income ranges, I mean, some of that also might have been a shift to Medicaid. So not every one of people who drop Pennie coverage is going uninsured. Our expectation is most of them are, but I think especially at their lower income ranges, some of that might have shifted over to Medicaid. And, that does happen every year. And the concern about the disenrollments is that it's at this point 4 times higher than it was last year. So I think that's far beyond the normal kind of churn we see, and really more of that uninsured. But I think at that lower income range, we might see more of that people did get picked up somewhere else.
Can we get that on that? I just think it's important to look at that population and know that for the future, if we can ever advocate to bring tax credits back for that population, how many folks decline? I mean, we know they can't pay full costs, so what happened? How many of those folks terminated?
Can see, and we're kind of limited in where they went, but we can try to do more of a.
But we would know the number of. That.
One thing we did this year that was different from years past is that we determined potentially we looked at potential Medicaid and CHIP eligibility and renewals. So in years past, we assumed that if your information hasn't changed, you're eligible to be renewed, we just renewed you. This year, we actively redetermined people, sent them over to Medicaid and CHIP. So hopefully more people found a good balance. But
Any other questions on the terminations? Excellent. So overall, both from what we heard anecdotally from some of the surveys we did, we saw that a lot of people who enrolled were coming from other coverage, not the uninsured, and a lot of people disenrolling, most of them were going uninsured. So our takeaway in combination with people shifting to bronze plans is that we have more people who were uninsured or underinsured at the end of this open enrollment than we did at the beginning of open enrollment. I think another thing we heard from our survey was that only 40% said that they could fit in health insurance costs without making moderate or significant changes to their household budget. So I think that's just another indicator of how much people had to stretch and change things in order to even get to the coverage they have now. And sort of whether they're able to sustain that throughout the year, to the various questions here. Just a second, that's fine then. And I think overall with the number, I sort of compare it to like a bucket of water, right? Like during open enrollment, we have people dropping coverage. We also were pouring in water from the top. So the level of enrollment, went down a little bit, but kind of stayed somewhat level. We've essentially put a lid on the top now because it's no longer open enrollment. Special enrollment periods are now more restricted. So we're not expecting to see a lot coming through there, but we still have water pouring out the bottom. So we are, have already, even in 15 days, seen that water level drop and are expecting that to continue. And I think so what we've seen with this open enrollment is, yes, we've had some new people come in, which is great, but we haven't actually prevented the concerns we're worried about it having a higher uninsured rate in Pennsylvania. And, the Commonwealth Fund did a study that said that they kind of projected actually very similar to the number of people who dropped coverage. And from their calculations by state for Pennsylvania, the enhanced tax credits expiring alone, the impact is $750 million lower Pennsylvania GDP, around 5,100 jobs lost, and around 49 million less in state and local revenue. And that's tied to expectations in a weakened healthcare system where there might be provider closures, or because of a higher uninsured rate, just pushing, fragile providers over the edge. But also thinking through, people who we've heard from, we've got a lot of testimonials that last year we had very few consumer testimonials. Now we have hundreds, and many have said that their ability to continue to keep their small business, to continue to work, is fully dependent on their access to affordable health coverage. And if they don't have that coverage, they're not working, they're, potentially becoming permanently disabled. There's one woman who has a seizure disorder, and her medication's like $500 a month. So without coverage, she's not able to afford it, not able to drive to her job, and putting her, like, it's in her own words, putting her own life and at risk of disability. She was also pregnant, so concerned about the impact of a seizure disorder on her baby if she had a seizure when she was pregnant. So it's stories like that that really show that it's not like solely about having health insurance. It's also just broader economic impacts for families in terms of whether they're able to continue working, having their small business, sort of contributing and doing the things they love. And I think that all kind of feeds into that number of, like, that becomes a broader economic issue beyond just the individual impact of delaying care or not getting care that people need. And it's always helpful to remember that we're not done yet with federal policies, because we have additional ineligibility coming up next open enrollment, where tax credits are people with lawfully present immigration status will no longer be eligible for tax credits. So that's going to be tens of thousands of more under 30,000, but 25 to 30,000 more Pennsylvanians who would have to pay full price, and whether they can do that or not is yet to be told. And then, as we touched on a little bit, next year we have pre-enrollment verification, which will add more administrative and cost barriers to coverage. So that's sort of, where we are right now from open enrollment, and what we're monitoring in terms of the outlook for the next couple of years on enrollment numbers.
So for the terminated population, we do follow up with them to find out where they have coverage or whether they have coverage.
Your surveys, so it's very dependent on responses, and we did get a fair number of responses. We feel like from the responses we got, they're maybe not necessarily reflective of the broader of everyone. Like, it was weighted towards 55 to 64-year-olds who responded versus, like, we don't feel like we know as much about the younger populations, for example.
Well, some of the younger population, particularly those under 6, presumably a good number of them are their parents.
I've heard that too.
Have we drawn that tie at all to try to follow the family? I mean, it's going to be hard to reach the 14-year-old, but 14-year-old is potentially I'm operating as follows. Where that patient went, the person may be terminated for 3 or 4 days, but carry the family with them. So if they had employer-based company or something, it's interesting to see. But again, it relies on people responding to surveys, which is always a challenge.
And we do have, Chachi, right? We have other surveys in the works. Like, we're doing multiple rounds to see if we can get more information. It is still dependent on them answering, but
Yeah, we'll be sending out more consumer surveys from us, and then we're also updating our uninsured data as well.
We're also doing a survey of the folks that we've enrolled along with that to follow people and see what's going on.
Did you say how many we anticipate losing of lawfully present space?
the impacted population is between 25 and 30,000. So some might be able to pay full price and we wouldn't necessarily lose them, but many, as we know, are not able. Those people are subsidized.
Is on the survey information, is it possible to share some of this, and what you're doing, like at board meetings, or has whatever data is finalized? All of us, it would be helpful to understand what's going on in the market.
Yeah, and you can add some of that to the affordability webpage as well. And then I think, again, if, you know, you guys have yours, public could always draw some of that too.
Any other questions on part one and of how we've gone through open enrollment? We are really early, Devin, right now. Did we want to do a break now, or do you want to roll through into the year in review, or do you anticipate that taping up? How do people feel?
What I'm doing.
Yeah, so
So you going?
All right.
Rolling.
This is our strategic planning session of the year. As usual, we're going to look back at what we accomplished tied to our goals that we had set out for ourselves. So with that, I'm going to turn it over to Jennifer Lloyd.
Excellent. Good morning again. I am excited to go through this section and just kind of highlight some of the accomplishments from our team this year. It was a very busy year. Obviously, a lot of work went into focusing on what was happening federally, preparing contingency plans, and doing a lot of engagement with state and federal offices. But even outside of that, the team worked really hard on improving the consumer experience, reducing administrative barriers for some of these processes that we have related to our program, as well as improving the awareness and education around what we offer. So, next slide. Just as a quick refresher, we had 4 strategic goals that were approved by this board for 2025. We will be carrying these forward. We think that they really encompass some of those broad themes that we want to look at and try to move the needle in strategically. So the first goal is really focused on having Pennie as a trusted and objective source of information. The second goal is around promoting simplicity and clarity in our processes and improving that accessibility of our program. The third is increasing awareness of Pennie at the local and state levels. And the fourth is educating on the need to make health coverage through Pennie more affordable. So the teams worked to advance each of these 4 goals, and we're going to highlight a couple of key projects where we had some significant outcomes. So under the first goal, trusted and objective source of information, we really focused on 2 outcomes for this year. The first one was really responsive to what was happening federally, and we wanted to mitigate the disruption as fully as possible for those consumers who were experiencing program changes. And highlighted here, the main initiative and the main way that we did that was around significant contingency planning. We brought a lot of those contingency plans to the board. We didn't end up needing to use those, but there was a lot of preparation that went in from the team to make sure that as we were preparing for the auto renewal process, if we had to run a separate auto renewal process after the October timeframe, that we could do so in the least disruptive way possible. And the other way that we really helped to inform consumers and bring them along with the changes was through communications. So as has been mentioned, we were a leader in terms of communicating early and often with our consumers. We send out over 25 direct communications talking about the expiring enhanced premium tax credits, what consumers could do to prepare going into 2026. And also, you know, when we were looking at surveys, just in terms of how that resonated with consumers, we did see a high consumer awareness that these enhanced tax credits were expiring. And so they were able to make an informed decision going into 2026, knowing that the affordability was going to change. The second outcome that we looked at was improving the quality of the program and really trying to strive towards accuracy and consistency with our work product. And so we targeted one of our key processes, which is the consumer escalations and appeals process. So we do, you know, see volumes there coming from the legislative offices, coming from social media, or just the traditional appeals process. And it's when someone doesn't understand maybe the eligibility determination they received, or, you know, if they have a change that they're looking for with their coverage. And so we did a lot of work, the teams did a lot of work to really focus on the communications there with the consumer, trying to educate them along the way. So it didn't have to go through the entire appeals process, and we can maybe save them some steps on the front end. And so when we look at the key outcomes there and kind of comparing year over year, previously, some escalations would take months to resolve. Some of them can be very convoluted as we're trying to go back and investigate their situation and how we can bring it to resolution. However, going into 2025, we actually brought the average resolution timeframe down to just 7 days on average. So, pretty significant decrease there in the time it takes to resolve, and good turnaround in terms of being responsive to consumers and to the offices that we're hearing from. And this decrease in the time frame to resolve occurred even with a 42% increase in the number of escalations from 24 to 25. And some of the increase in escalations, we have done a lot of work in terms of making ourselves more visible to legislative offices, to stakeholder groups. And so we do think that people know more, where to kind of send things. And so we do think that played into some of the increase in the number of escalations, but we're still able to have that good resolution time frame.
Jennifer, how many, what is the number of escalation? Dozens, hundreds?
Couple hundred. Yep. Any questions on the contingency planning for enhanced premium tax credits or our appeals process? Okay, slide. And then just closing out on this goal, another area that we looked at more operationally is program integrity. There's been a lot of conversation on this in kind of the federal environment. It's also something that we take very seriously and look at consistently. And so we really targeted looking at our broker population and making sure that there was strong program integrity and accountability with those partners. We recently looked at 54% of our enrollments are tied to a broker. And so that's significant. And they are indirect representatives of Pennie. And so we want to make sure that any information that they're giving or action that they're taking, that there's that trustworthiness, so we can also maintain Pennie's credibility. And so we worked to really hold brokers accountable for any inappropriate actions more quickly, work very closely with the insurance department, and kind of referring any bad actors over to have further investigation and to take action. And actually, in some instances, there's warning letters, other instances, there's suspension of a broker's license. And so we were able to do that more effectively. And also we're able to refer dozens of cases over to be handled.
Excuse me, this is Joel Hopkins. Is that a two-way street? And maybe that's a better question for the commissioner. Is the department also sharing with Pennie when it's got pending investigations or concerns with brokers?
I think to the extent that we would have a complaint that is related to Pennie, that our teams would coordinate on those complaints.
Thank you.
Any other questions on some of the work that our teams accomplished under goal 1? Okay, moving along then, we have our second goal, which is related to accessibility and creating simple and clear processes for consumers. The two outcomes that we really looked at under this goal related to reducing consumer burden in terms of the time it takes to go through processes or the number of steps that a consumer has to take. We also looked at improving understandability of the Pennie program. So more resources, bringing down kind of the reading level to a more accessible format so that we can have a really informed consumer base. The first initiative that we looked at or that our teams did, especially our operations and IT and policy team, was looking at some additional wage data sources. So one of the main processes that our consumers have to go through is if there's a discrepancy in their income when they're applying and trying to enroll. We typically were looking at federal data sources, but the team was able to work with our state Labor and Industry Department to start bringing in some of their wage data quarterly. And so in doing that, we were able to actually resolve 43% of those DMIs or data matching inconsistencies that were generated during auto renewals. They were able to be resolved by this additional income data source. And so that's one less step that those consumers have to take in terms of uploading documentation and potentially putting their coverage at risk if they're not able to resolve it in time.
Hi, it's Amy. Does that happen sort of behind the scenes? Like they don't know there was even a data matching issue?
Correct. Anything else you'd like to?
So for auto renewals, data. So in the auto renewal process, we use it as a kind of a real-time check in the same data source. If a DMI is generated, then we have a monthly check that goes behind the scenes. The consumer would know they had a DMI, but they would also see clearance if the labor and industry wage data was sufficient.
We know, I know 98% of people enrolled in the plan displayed simplified plan. Do we know how many people triggered the expansive list? As part of that or?
Like flipped toggled out of
Yeah.
so 98% stayed in, so it would be 2% toggled out, right, David?
I thought that was just enrollments, like they could have toggled to see everything, but came back and enrolled in one that was one of the simplified.
So I don't know if we have that data, but so 98% of active shoppers enrolled in a feature plan of insurance, chose a feature. And then of active shoppers who were previously not enrolled in a plan that was featured this year, 2/3 of them did enroll in a plan that was featured this year. Those that changed. So preliminarily, it does seem that plans that were featured were plans that we liked and were able to get what they needed from simplified plan view. I think we need to understand more about, we need to dig into the data on that a lot more, but at least, people were able to find the plan that they wanted. Simplified plan.
People that auto enroll, if it was a non-preferred plan or an additional plan, they still stayed at additional. Didn't do any big.
No, so I think probably, a lot of that, for active shoppers, I think that speaks to maybe, hoping that it speaks to people found value in simplified plan. Obviously, if they were renewed from already the plan, they just happened to be featured this last year, that.
But it seems successful in that people were satisfied and enrolled. Limited simplified.
It's another question too, is did you see fewer people drop off? Right? Have you looked at that stat to see if you had fewer people that decided to just abandon the process because it was overwhelming when there were so many plans? Do you see more people completing and enrolling in coverage as a result of the new view?
I think that was one of the metrics, because we had a whole list of things that we were going to look at. Several of them will take time to kind of dig through. So we were planning to be able to come back on that whole metric sheet that we had later this year to kind of do a look back. It's a little too soon, especially of like how long do people stay in the process. I think one of the things we were going to look at is completion rate. But we were also going to look at stay longer than others if they use that process. So we had a whole bunch of items that we were going to look at, some of which take a little time to play out. So we do have more coming on it. That's just sort of like an initial piece of data we saw.
I guess when we first came up with those metrics, it was before all of the financial constraints, right? So I feel like the completion rate, like did you get more people completing the process, or worse than what we were doing before with the simplified plan view? I think some of those stats are going to be more important than the payment piece of it, just because that's kind of out of our control. Like the change in that view isn't going to give people money in their pockets, right, to be able to pay. So.
Yeah, one of the concerns we talked about last year that there could be potentially some noise in the data because of how much costs were changing and that disruptive factor might cause some noise. So, I think we're gonna do the best we can to glean what we can. And we have some focus groups as well to try to get more of a pair qualitative with quantitative. And those are planned for next few months.
And you'll have data on even the volume of people that pick certain simplified plans and non-simplified plans. Because I think part of why we looked at this was just plan decision overload, where, I mean, people felt flooded with hundreds of plans. If people are satisfied with 36 or however many, they more than 36. Then I think that some of the non-preferred plans, you may have dozens of people, certain plans that maybe aren't as popular and to lead to further conversation about whether it's in the company's interest and Patty's interest and consumers' interest in having plans that nobody enrolls. But I think that could be kind of data-based. What we see throughout the rest of this year, recognizing that this year is a challenging year.
And I think the other part too is some counties, it doesn't have much of an impact because there were already in some counties, there weren't an overwhelming number of cases where, and that was, I think what we were attempting to try to even out a bit is that some counties had upwards of 100 plans. So I think that's also part of the plan to look at is looking at specifically the counties that had large numbers before, and if we saw anything different.
Yeah. Did we get any feedback from the brokers on kind of what they felt about simplified plan design? Not plan design.
Not a great deal, no. And we also try to track consumer sentiment as well, using analytics from our call center, but not a lot of mention of the filter analytics side.
Yeah, I don't know from the assister perspective if you heard any feedback.
Well, from our sisters, not many of them went to the other view. They stayed on the simplified side. Said that consumers were able to pick what they needed from there. Didn't even talk.
Carl, did you have a question?
Yeah, thanks. Going back to the first initiative, if I understand this correctly, 43% of the auto renewals that you otherwise had a data match issue with were resolved through DLI information. Is that right?
Yeah, so essentially, automatically, the first check goes to the IRS. Of the DMIs that would have been created after that first check, we were able to resolve the non-DMIs for 43% based off the industry wage data. That we
Is DLI the only other source you have besides IRS?
We also currently still use a tertiary data source, which is Equifax. If you recall, we had to switch to the Equifax service in the recent past, about a year ago. We still have that in place as a tertiary source, but in the next board meeting, we're going to be discussing whether or not we keep.
And that's Equifax through Federal Data Services.
Yes, exactly.
Okay. And to your hierarchy right now is IRS, DLI.
Exactly.
It's Amy. So do you go to Equifax if you can't resolve with LNI?
Yep.
Like automatically?
Automatically. And then so say in special enrollment period, someone applies today. The Equifax check it's not a real-time check if it's not more on because of the way we got the data. It's kind of like this style. You have to send it a monthly to get it. So if you were to apply today, IRS would be your first check, Equifax would be your secondary check. And then if you had a BMI created, the monthly files would try to resolve that through the labor industry data.
Okay, so
Depends which time of year and which flow rate system.
Yeah, it's not real time, but with the auto renewals, since auto renewals is not a real time process, we're able to put it in before we even create the data matching issue for open enrollment. But when someone comes in and applies live, we don't have like a live check to labor and industries data to do it on the back end.
Any other questions? All right, so these two initiatives were pretty significant change requests. So just kudos to Rob and his team for all the work in kind of doing this, as well as some of the contingency plans that were ongoing throughout the year. some real, consumer experience improvements there. We also, the external affairs team looked at the FAQ page on penny.com, did some additions there, simplified some of the content to try to make it more accessible, and also reviewed all of the consumer facing materials for plain language. So again, just trying to provide more resources in a more accessible format to help people navigate the process. All right, the third goal was increase our awareness. The way that we went about doing this is really related to our advertising and marketing campaigns. So in the summer of 2025, Pennie launched a value-based ad called Worth It. And so that was one ad. We also launched another ad, and it was a checkbox spot. And so you had someone that was really speaking directly to the consumer, and both the uninsured and Pennie enrollees kind of telling them what to do and how to navigate the process, especially with some of the uncertainty this open enrollment period. And so with that, we did see some improvements in terms of how often they were seen. You'll see the increase there. Clicks on links with some of the digital ads, as well as just those that were listened to or viewed. So those were successful in terms of what they were trying to accomplish. Chachi, anything you want to add to that?
No, take any questions.
Chachi, we went way up on how many you've seen, but not significantly on, what do you read from? Kind of in yours?
Yeah, I mean, from there, it's, I need to dive in a little bit more and have some more analysis with our vendors on that one. But my initial take is that you're seeing the ad, but you're not taking the action. So is the ad not it's not influencing the behavior that we're looking for? It's really
It could also be like, I didn't click on the Pennie pop-up right now, but I had Pennie in mind, so I opened a new tab or something and went directly.
Yeah, or you let it sit for a bit and then you just went to penny.com directly. Because the third highest way that somebody comes to penny.com is through our paid ads. It's organic, and then search and then an ad.
I felt like I saw it this year, like if I was online or.
You're not even our target market.
Whatever. I think my kids may have even seen it on they're on YouTube. I feel like they ran into a Pennie commercial once.
They clicking?
Phone might have been listening to you.
Well, sure.
And then the completion rate going down, that's if somebody's watching or listening to an ad all the way through. And I think that the reason that it went down this year is because we had two spots or two commercials. The one that had the higher completion rate was the worth it spot. So it was the more value-based spot. And I think since the checkbox spot was talking directly to the Pennie enrollees and the uninsured, that it's potential that they saw that first, hey, if you're an enrollee, if you're the uninsured, maybe you thought, maybe that wasn't for me. So it could move us toward either optimizing that where you speak to the uninsured first and an enrollee second, and making sure that we're getting that ad, directly to the person that we know where they fall into that bucket.
This will tie into a later conversation about potentially more ad buy, right? Any other questions on the outreach piece or awareness piece? Okay, Jennifer.
And then just to close this out, on top of the marketing and advertising, the other way that we really try to increase our awareness across the Commonwealth is through outreach events. And so the external affairs team onboarded a new sister contractor, HMC, and really had them establish in more regional organizations. And so had them more spread out across the Commonwealth. And what this led to was more outreach and enrollment events. You'll see the increase there from 25 to 26 for OE. And just more counties reached, pretty significant increase there from 13 counties in OE 25 to 51 counties in OE 2026. And so outside of the contractor, we also have an internal team of 3, our outreach team. And so they also are conducting outreach events. And so they did about 64 of those for this open enrollment period.
So Cheryl, do we know how that translated into enrollments? You know, in the past, historically, it was fairly small. Is there an uptick in that?
It goes back to the, in the OE slide. I would say, it was on par with what we've had in the past.
And we can circle back on that as well. I think there's the 2 aspects to that hub and spoke is both one outreach where it's just building awareness and someone might later go to the website and then also directly assisting it.
So an event like, just trying to understand the difference a little bit between outreach and, like outreach would be like the farm show. You had a tent, you had a booth, and I mean, Pennie was a sponsor, so I saw lots of Pennie at the farm show. And then enrollment is kind of specifically like you're in tables and chairs type of
Yeah.
area.
Yeah, enrollment event, how we have it defined kind of in the contract is an enrollment event is one that you're free promoting so that folks show up with the right materials that they need and that there's more private space to be able to.
Because if you're at the county fair.
Yeah, you're
somebody's
not gonna.
sit down and enroll in insurance.
Right. Yep.
And then the enrollment assisters themselves can also like set appointments to do that directly outside of the events, completely just directly with an enrollment assister who can help them walk through the application and enroll. So there's a few different categories of on that. I would say that continuum from purely outreach to sitting down one-on-one with someone and enrolling them. And, you know, with enrollment events, you sort of have the in between where it's both outreach and like having the capability to help someone else.
Do we do like, I don't know, pop-up storefronts like that, almost like that big
Halloween?
Yeah, yes, like that, but like during open enrollment, do we have like in a shopping center or something that maybe has space type of thing?
I know that Mendoza has a pop-up store or a pop-up shop in Chinatown in Philadelphia. It's a good idea. So
Just curious, like what seems to be more successful than others in terms. And
We used to do that a lot when Enroll America was in Pennsylvania, and I think it had mixed success, right? It was more successful to go to where people already were in trusted organizations and stand up in a Pennie or at the time like healthcare.gov storefront. Just because people thought it was another like health insurance company or broker.
Aren't we
Just-
terrible? Yeah.
And they would invite, you know, Independence and Cross and Van and everyone to be there to help folks. But I think it transitioned a little.
And I think like insurers, a lot of you have storefronts. I've seen UPMC, I've seen Highmark and Camp Hill and Capital. People can walk in and just enroll there as well.
Yes.
I presume you have events, sometimes in partnership with Pennie. No,
I would
do
say
you ever do that?
we've done stuff with legislators, but not with Pennie. I think I know we had conversations to get you connected with other people in our market, but don't join them.
Yeah. And also I think one thing we'd want to keep in mind there is like that Pennie's not endorsing any particular, sure, you know, so I think we tend to focus more on community organizations that are.
I would, this is Ellen, share that we've also explored the pop-up stores and I think have had similar feedback. I think had more left with, I would say, a trusted community place, a library than a shopping mall, just as a like example.
We used to do pop-up events too. Like I think in the earlier days, I think there was more of a need for the awareness. So you kind of, you had to, you know, larger volume of people that made it worth the expense of going out. Like we had a truck that we took for this, you know, it had 14 stations where we could enroll, right? We went all throughout our service area, but over time, especially with the pandemic, like people figured out during the pandemic how to self-serve online or through a broker or through an assister, you know, where they didn't have to go face to face.
I think part of we did have to get this new contract up in a pretty short timeline for open enrollment. I think part of the long-term goal of it is to be able to have best practices shared across the different regional organizations as people try new things and allow that reach to involve with where people are at, try different things and see what's working and not be able to share that. And so I think that's sort of the moving into that phase from just sort of the getting the fundamental components of the contracts.
This is Ellen again. It's a similar question. How engaged is Pennie with what I'll call the financial counselors in a hospital? So the department that is, I don't have insurance right now. I know that our own systems we've been advocating, but I don't know like how tight that linkage is with Pennie today. Someone shows up at a hospital.
Like folks in the revenue cycle part.
Revenue cycle, some hospitals I would say have a team that is there to help, whether it's to facilitate Medicaid eligibility. I keep hearing more focus on Medicaid than I do on Pennie, and I feel like it needs to be both.
In the early part, when we were standing up Pennie, we had a real outreach push to kind of educate those within the hospitals, health centers, and those that work kind of in the administrative or the revenue cycle side.
Yep.
Wouldn't say that has been like the strongest push with us as of, recent, but we do have some regional organizations that primarily work within, those types of systems. So, we could probably pull some, best practices out of them and see if we can, implement that with other regional organizations.
I think the other challenge would be on the ACA side of the house is just the SCP eligibility. Like that would be a concern if we're just getting people maybe don't still qualify, but that have health needs, right? Like that then becomes a risk for the long-term, I can't say it, sustainability, of the ACA market.
Yeah, I think also we do have a no wrong door. So if people apply to Medicaid and they're not eligible, they do get transferred over. You still have the SCP limitations that if outside of open enrollment, they may not be able to enroll for months. But I think it's a good question of just I think we've talked at various times about just making sure that those folks in those roles have like basic critical information about Pennie, just even to be able to provide basic. So like, can you enroll and things like that if it's not an option at the time?
In previous years, there were lots of enrollment assisters outside of the contracted folks. They were stationed in hospitals and other locations. So to speak to your point, they were educated on the process as well and understood Medicaid, because that's part of the training. And there was an interesting model back in healthcare.gov days. Hospital Council of Western Pennsylvania, I don't think they're called that anymore, actually was a federally contracted navigator. They were part of our navigator. So they actually had assisters in hospitals, and hospitals would go out under the navigator.
And I'll just make this as a general plug that, on our, so we have pennie.com and then agency.pennie.com, which is basically for everybody but consumers. And we have a free printed material. So it doesn't matter who's requesting it. We pay for it to print and to send. So with any stakeholders that you come across, send them there for, at least print up flyers or banners. And if they would like to go through and become an assister, that's a nominal fee through the insurance.
Another question? You have another slide.
Great. So to close us out, we have our final goal, which is related to affordability education. This year, we kind of formalized our legislative affairs office and took a very proactive approach in terms of reaching out to the federal delegation and doing engagement there. We also took a proactive approach in reaching out to state offices as well as the administration and just kind of educating around what was going to happen if the enhanced premium tax credits expired. And so we set up two major web pages this year. One was more consumer facing that focused on education around what was happening. And it also gave consumers an opportunity to share their story and submit testimonials. And so we saw significant engagement with this website, over 60,000 visits in 2025. We also collected over 300 consumer testimonials about some of the challenges that people would be facing with the increased costs. And so we were able to use those in terms of engagement with stakeholders and engagement with some of the legislative offices. We also set up the pennie.com/affordability webpage. We tried to be very transparent on there in terms of what we were sharing, how frequently we were updating it to keep it very relevant. And we directed a lot of policymakers and stakeholder audiences to that webpage so that everyone could kind of be speaking from the same information. And so we saw over 17,000 visits to that webpage. It was also very regularly referenced by stakeholders in terms of the conversations they were having with the delegation, as well as media outlets. Pennie also, we took an active role in terms of doing stakeholder briefings this year. So I think we did 2 formal stakeholder briefings with over 70 different Pennsylvania organizations represented. So we had consumer groups, we had health insurers, we had hospitals, just nonprofits, a wider range of organizations across Pennsylvania to really share with them what was happening federally, any updates that were coming through, how Pennie was responding, and the data that was available. So we're really trying to establish ourselves as like a leader in terms of education on these health policy changes. And we also shared there some of the congressional letters that we sent. That kind of specifically laid out the impacts that we were anticipating from the increased costs that were going into 2026. And then finally, we did see a pretty significant take up from media. So over 65 media interviews and over 220 mentions in some of the state and national publications focusing on Pennie affordability. There was a large push nationally with our national group, some of the other state-based exchanges, to be doing media and trying to drum up attention on this issue. But then that also translated to some of the state press that we were doing. So there was a real impact there and a value add in terms of just raising awareness on the program and raising awareness on some of the issues that our consumers were going to be facing. So that was a lot of the work that we put into preparing for a hopeful extension of the enhanced premium tax credits, or at least educating around the impacts. And then the other initiative related to affordability is at the state level, which is our state health insurance affordability program. So we do have the authority for that program codified in the code. We do not have funding for the program at this time. And so the way that we prepared, our IT team worked with the insurers to make sure that the functionality is ready to go. It's in the system. It's just about ready to go live when that funding does come through. And we also looked at some additional models as a lot of circumstances were changing this year in terms of who our enrollees are, who's disenrolling, who's staying. And so we wanted to make sure that our models are as up to date as they can be, especially as we go into some of the budget hearing conversations and just legislative conversations this year. So we're going to have more on the updated modeling results in a later section.
I'll sort of wrap up the 2025 in general. And I just want to just call out Jennifer and her team. I think we did really expand Pennie's presence across Pennsylvania in terms of an educator on the impact of these federal policies, and really work to collaborate and coordinate and provide data to people who are looking for that information about what these impacts would be. In order to really kind of give voice to the consumers that we serve and make sure that that voice is being elevated and those impacts are being elevated to different people. So thank you, Jennifer, for that. And I think also just looking at all these goals collectively, we had set out to do a lot of work in this area. And I think we really achieved much of what we were looking at, but also we did not anticipate we were going to be doing that in the midst of HR1 and all these other different pieces. So I think really just part of the collective team and the ability to stay focused on what our core goals were, while also kind of having all the swirling happening from the federal level. So I think that wraps up our 2025, and I think we have a lot coming towards us that we'll talk about in the afternoon, but I think we've really accomplished a lot of what we set out to do while also managing the constant churn external.
Any questions? So a time check. We're supposed to go to lunch in 20 minutes. We have lunch until 12:30. I think maybe we just extend it. Still plan to come back at 12. Give people an opportunity to catch up on email and whatever. else you do. Temperature check.
It's freezing.
I felt the same way, but I was gonna let somebody else suggest that we could address that even.
Yeah, well,
So.
and I'm done this morning, actually, which like already didn't know something amazing.
Till 12:30.
Right.
started at 10.
We'll get started on part 2 of the strategic planning session. Devin, I think I'll turn it over to you to start talking about our priorities for this year.
Great, thanks. So the second of the meeting today is going to be looking forward to 2026 and beyond. A lot of what we're focused on for 2026 has to a large extent already been decided, first from the decision of the board last year to shift to an in-house call center, and really the significant operational effort that will be behind launching that in time for next year, early 2028. And then the implementing the federal changes that we walk through, that we'll go through in more detail, but we have changes related to enrollment periods, eligibility, and then the significant change of pre-enrollment verification for next year. So a lot of that is sort of, those are pretty big undertakings of themselves. We will continue to, amongst the teams, really drive towards those higher level strategic initiatives, those 4 goals that we set out last year and that we're continuing to move forward. So continuing improvements on consumer escalations and all sort of the day-to-day work we do. But really sort of having these large items be the driver of a lot of our larger projects. And then of course, the last one here on affordability, focusing on both the impacts of the enhanced tax credits expiring, but also other things that we could potentially do to help mitigate to some extent the affordability challenges that they're seeing. So just wanted to talk through again, kind of how those larger initiatives fit under the goals. On the next slide, we have the familiar goal number 1, establishing Pennie as a trusted and objective source of clear information. So this will really be focused on the call center, or the goals that we walked through last year are really to improve the quality and consistency of information that is being provided to consumers through the call center. And by having it in-house, having more direct control and oversight over the training, over the quality assurance, over all of those pieces, and having more of a direct tie between our eligibility and programmatic experts to the call center reps on the other side, we think we'll really be able to improve that significantly. So that effort really ties very closely to being able to provide that clear and just. The second one, promoting simplicity and clarity into processes to improve accessibility. We here will be focused on implementing the federal changes. The federal changes are of themselves not making the process more simple for consumers, but our goal is to implement that in the most consumer-friendly way and really taking what we're coming to call an effort neutral approach. And the idea behind that is that if we have to put in a new step for consumers, we're finding another step somewhere else in the process that we can remove so that in total, it feels effort neutral to consumers. It doesn't feel like another operational burden. Now, that's not always going to be a perfect science. It's going to be more art and science, and sort of trying to find ways to reduce steps downstream. If you have to put, for example, a pre-enrollment verification and extra steps up front. But that really is our intended goal of trying to implement these changes in a way that has the least disruption possible to consumers, and pair that with our best practices on communication to make sure that people are very clear about what is needed from them, especially with some of these changes and these steps. On the next slide, the third goal is increasing awareness of Pennie at local and state levels across Pennsylvania. Walk through our 3-year uninsured plan, our plan to continue to grow our presence across Pennsylvania, continue to reach more uninsured using different tactics and strategies. So we have year 1 under our belt. This past open enrollment, we're going to do analysis of that during this non-OE period and use that to refine our year 2 and year 3. And then educate, and then also, as we mentioned earlier a little bit, continuing to build out that assister network. We got that stuff pretty quickly for this open enrollment, and so really looking to fulfill all the potential of that contract that we saw when sort of restructuring it and really working towards that over the year. On number 4, educating on the need to make health coverage through Pennie more affordable. This would really entail continuing the ongoing analysis of the impacts of the EPTCs expiring. A lot of great data points were talked about earlier that we'll put on our path to monitor, to track, and throughout each board meeting this year, we are likely to bring back more and more information about what we're seeing over time as people grapple with the higher costs. And then, of course, on the affordability side, pursuing affordability options, continuing to look at that, and we'll talk about that a bit later as well. So on the next slide, several of these we're going to talk about in more depth, so I'm not going to go through this in detail. I will just call out two that we're not going to have a deeper slides on the increasing awareness of Pennie, the continued implementation of the 3-year plan. So, that's really analyzing what we've already done and continuing to refine that as we move out, and then the strengthening the sister work. But the rest of these, we have sort of a deeper dive into our plan for these different areas. Before jumping into the deeper dives, any questions from a high level of what we see as the path ahead for this year?
Guidance.
Evidence. All right, so for the first one, it is the call center product. So have our Director of Operations, Jim Lefko, who's going to walk us through plan for the call center.
Thanks, Devin. Good afternoon, everybody. As Devin said, my name is Jim Lesko. I had the opportunity, I think, meet most of you in some way, shape, or form last December, or I should say this past December. But I am the Director of Operations, responsible for the call center and our insure ops side. So for the call center project, I am the project lead as we go through this next 22-month project. Just so a very high level summary here we want to talk about. So as you recall, back in October, we did receive board approval to begin the process of internalizing our contact center services and transitioning away from our current vendor effective January 1st, 2028. A lot of thought went into this approach that we landed upon, creates long-term strategic value by providing full governance and control over service delivery, better insight into training and performance, clear alignment with our missions and goals, and of course, greater flexibility to scale staffing and manage costs effectively. Again, I think as we discussed some of the challenges that we saw this open enrollment in particular, we believe that where we housed internally, if we had an internal contact center, we would have been able to more quickly better react to some of those changes in demand. So we've developed our project plans thus far, and we've begun work according to the implementation roadmap that I'm going to go over in the next couple slides. So I'm going to just briefly touch on this slide because we have some more detail on some other ones. But basically, as we said, between now and January 1st, 2028, which is oddly enough a Saturday, so I guess technically the 3rd of 2028, we have 3 kind of pillars that we're working. So first and foremost, for the rest of this year, is our strategy and foundation. We have to make sure that everything we build upon is structured appropriately, is sound, and gives us the opportunity to grow and deliver as we get into more tactical approaches in the coming years. 2027 is our workforce building readiness. Again, that's largely exactly what it sounds like, and we can talk more detail about that. And then, of course, 2028 is our launch and stabilization timeline. So as we said, we have that early 2028 launch. We need to be able to make sure that we are on track with some of the goals that we've set for ourselves as 2028 goes on. And then, pre-know it'll be Q2 and Q3, and we'll be getting ready for our first full-blown open enrollment for OE 2020. So, thank you. All right. So again, talk a little bit about 2026, a strategy and foundation. So what does that look like? Well, first we need to solidify our contact center mission. Again, we outlined a little bit of what we believe that it offers us as an organization. One of the things we've been talking about a lot is that this is the benefit of a contact center that's built by Pennsylvanians for Pennsylvanians. That's what we're really excited about, is take that control to be able to continue on the work that Pennie's done over the last 6 years and make it even more consumer facing, that ability that someone's calling in and you're getting Pennie employees within Pennsylvania to have that opportunity to really connect with folks that are your friends, neighbors, coworkers, and really just continue that high level of service and really build out that Pennie brand. We've spent time establishing our work groups. We know, of course, operationally, there's a heavy lift. There's a heavy IT lift. There's a heavy HR lift, policy. So we've built out some of these work groups to make sure that we got the right people in place to have these conversations and to start building these project plans in more detail. Governance structure, of course, kind of goes hand in hand, and we've worked through working through defining and approving the success measures. So I mentioned previously, when we think about success measures, it's not just January 3rd, 2028. we have to think about what do we expect the contact center, how do we expect to perform January 3rd, 2028, April 1st, 2028, July 1st, 2028, kind of some of those Q2, Q3, Q4 metrics as we ramp ourselves up to full potential. And in order to do that, we have to have all of our technology in place. So again, Q2 this year, we're looking and we're currently having conversations now to understand what are our best options from a technology stack standpoint. When we talk about technology stack, we want to talk about our CRM, our telephony, our knowledge management systems, our training modules, our quality assurance modules, all those types of things to make sure that once we're ready to push this forward, we're set and we have some of these pieces of technology in place long enough that we're super comfortable with how they operate, with where we need to provide additional guidance for our teams, because maybe this is a little quirky or not, and just to be better situated to be as effective as we can once we get to the floor. Q3, we're looking at an implementation setup. Again, we're trying to onboard an implementation partner. We're all aware that this isn't something we can take on our own, so we're looking for a little support there. As I mentioned, we want to stand up the technology stack. And then, excuse me, yes, sir.
Joel Hopkins, is that an RFP process for that partner?
Yes, sir.
And is there any utility to having that happen in Q2 so they can work with you on your tech decisions?
I believe, and Rob, correct me if I'm wrong here, where we are right now is we're a little bit beholden to the process itself. I think it's a timeline. To your point, I think the answer will probably be yes, but I don't believe we're able to get them in any sooner than September, October timeframe.
Yeah, RFPs are like an 18-month process. So we've speeded it up already. Is it wherever we can cut time we're going to?
We have, to that point, we've engaged as many internal resources within the Commonwealth as possible. We're trying to make sure we're meeting with other state agencies that are operating contact centers to understand their technology, see if there's any internal, kind of Commonwealth agreements that we can leverage to make sure that we're in the best position possible, not just to make sure we get the best tools we can, but also to ensure that there's as much kind of in-house tribal knowledge, if you will, of how they operate, so that we have that support.
And do you know, is there other states that are on the GI platform that have gone this pathway that we can look at what software they use? Because it'll have to integrate with GIs, right?
So there's one GI state that has an internal contact center, and then there's another couple that have vendor managed contact centers. But we do work closely with the one that has an internal contact center for best practices and any tips that you request. And then Joel, to your question, for the tech stack, we're also fortunate that we could leverage existing state resources. So we have someone within the Office of Administration that actually provides this type of service for all of our sister agencies. So they're assisting us with actually doing the evaluation as well. So there is kind of an independent evaluation that's double checking our work, if you will. But it is, we're working closely with them to use best practices from the other agencies that already have their own existing tech stacks as well.
Anything else on that piece? And then so the last bullet there is Q3 to kind of leads into Q4 of this year. So we talked about developing and finalizing their job descriptions for what just kind of generally calling non-frontline staff. So these are the folks we don't expect to be necessarily answering phone calls. These aren't our customer service reps. These are our quality folks, our training team, because we recognize the importance of getting them on board early to help us build really quality programs. We don't want to be kind of changing the tire of the car as we're going down the freeway. We have this opportunity to build this from scratch, to get started as soon as we can, and make sure that as we hire and onboard training and quality professionals, they can help us build what's a really good product to roll out to our CSRs when we do bring them on board later in 2027.
So how soon into 27 would you be hiring folks, the non-frontline folks?
Yeah, so Tanya, thank you. Yeah, so I think one of the things that we're.
What, 27?
Yes, sorry. I think I don't think it went forward, sorry.
It's stuck.
That's all right. Yeah,
yeah.
there we go. All right. Thank you. So from our contact center standpoint, again, we want to try to bring our supervisors at least in Q2. The hope is probably the later side of Q2, so May, June timeframe to bring those folks up to speed and then start hiring our peak workforce, our customer service reps, in August to have them ready to go for October 1st. Yep. And so, oh no,
Sorry
sorry.
if I may. So also to your question about the non-frontline staff. So if you recall, in previous board meeting discussions, we had talked about having kind of what our non-union staff being brought in. The goal is for all of them to be in place, all 13, by the beginning Q1 of 2027. So some would happen in 2026, but the other training and development staffs and quality staff would come in first quarter of 2027 as well.
When would you do the budget for supervisory staffing, frontline workforce, that bulk of the hiring?
Yeah, Heather, I think we have budget for that. I do think we presented that previously. That's why I don't want to speak to it. So I don't want to say something wrong.
Yes, that would actually be in the next cycle, the 2027 budget. So like in August or October, that'll be the next.
When do you believe you'll have a sense for what the posting salaries and benefits will be, things like that? This will have a big impact on the Commonwealth.
Sure. Absolutely. I can say we're actively talking through that right now. I think we're trying to understand the best way to build this in a way that kind of aligns, because we've talked about it being a union. Want to hire union workers, so we want to make sure that our posting aligns with the expectations for those types of positions. And then also to make sure that what we post at and what we hire at offers kind of a path forward for those folks, a career progression of sorts. And then also that it aligns with the work they're going to do. I mean, the contact center, we get everything from and I think we talked about this before, I can't get into my account, all the way to some of these much more complex issues that require a seasoned hand. So we're actively viewing right now, the operations team is looking through call dispositions and any other call related data that we have to figure out, okay, where are the bulk of our phone calls landing in terms of what people are asking for? And I think that's going to have a big impact on just the way that we staff and kind of how we stagger the level of our customer service reps to get started.
I'll just say when that's known, it will be of great interest to the department.
Sure.
Because
Yeah,
of what I
absolutely.
described.
Sorry, just as we're thinking about all this stuff too, and I know there's chat capabilities today, is that right? So what's the plan? Like, are we also simultaneously going to think about it's like a chat bot or something that could handle maybe some of the lower intensity calls so that we can control the number of physical staffing that we have? Like, what's the?
Yeah, no, it's funny because I think one of the things that I've been saying repeatedly for the last couple of months is my goal is to find a way to minimize the number of calls that we receive. Right, as we go through this, so it's identifying anything that we have. So we have a call disposition form that our current CSRs through the vendor are responsible for completing, and in viewing that, we're actively working to identify kind of tiering those types of calls to understand how many of these, is this a level 1 call, level 2 call, level 3 call, et cetera. And then within those, how many of these are possibly candidates for some sort of automation, whether it's through a chatbot, it's through enhanced FAQs. Is there something we can set up in the IVR through an IBA that allows us to get through that? So again, I think the whole, as we build this up, like I said, we have this opportunity to create this from scratch. We're not beholden to what our current vendor does. So we want to make sure that we're offering our consumers the most accurate and effective kind of self-service modules to keep those call volumes down. And again, especially given what we saw this last December, I think that's to the point Devin was making earlier. If there are things we can do, even renewal verification when we get through there, are there opportunities to just keep call volume as consistent and manageable as possible?
What percentage of current call center reps are Pennsylvanians?
It's a good question. I don't know that answer, to be fair.
I think last I had seen for open enrollment, it was about 60 were Pennsylvanians, but that was a marketing, which have always been just a couple dozen. We had asked our vendor to push for hiring more Pennsylvanians about a year ago. They did follow through, but it was still a majority was probably south of the majority Atlanta area.
Okay.
So 60 was the number, not the percent.
Yes, 60 is the number, my apologies. 60 out of, say, 275 to 300 CSRs, depending.
I think we talked about this before. What the plan would be to have a base set of, I don't know, 100 people and then we would staff up in high time. I forget what those numbers may be.
Yeah,
So the model that we're currently working off of, and this is subject to change if we see enrollment drops have decreases in call volumes and contact volumes as well. But we're currently working off of a model of 130 core CSRs that would be Pennie staff. And then we'd have surge staff coming in. As it currently stands for 6 months, there would be a different amount of staff for each month. But for 6 months, if we see volumes change over the next year in terms of contacts, that could decrease.
And that would get us up to whatever you said was
So basically,
270.
yeah, but by historic volumes, 250 is actually what we realistically need to maintain our average handle times and our speed to answer that we want to have. So we're targeting 250 with search staff in the primary months.
Are the current agents unionized?
No.
So I guess I'm curious as to why just a question, right? Not a,
sure.
as to why union versus non-union, I guess.
Most likely just the hiring landscape within the Commonwealth.
Well, it's civil service. They have the other option, but it's a civil service state employee versus, I think, union non. So they would be full-fledged state employees, like all Penn State.
Yes.
Okay.
For
And then, sorry, the 60 that are currently with Get Insured, is there an opportunity to convert that, or is there something in the contract that would prohibit us being able to take those if they're high quality, obviously?
I think technically it's out with employment, but it would be subject to if those 60 would apply to our postings. I don't think we would actively recruit them, but if they would apply for the postings. If they met all the criteria, then
I mean, if they're good, you would shorten your ramp time,
Yeah.
right? Like just to.
So I think, again, just to go back to the slide here, just to kind of, I think we end up covering many of these things just in our conversation. But again, so early 2027, part of the reason we need to have the tech stack up and ready is because we think in early 2027 is when we need to start implementing our policies and procedures. We want to make sure that those are written, that they're approved, that they're effective to use by the staff that we bring on board. So we want to have the KMS, especially the LMS, and again, and you all have gone through this, right? In order to have effective documentation, you've got to have the system, see the system, understand the system. We said Q2, we want to try to bring on our onboard our contact center supervisors. And then in Q3, we would bring in the frontline workers. A big reason we're focusing Q3, and as they said, ideally, we're looking for on October 1st, start for those individuals so that when we get through our training program, which is likely to be somewhere in the 6-week range, but again, we'll know more as we kind of build that out a little bit. There'll be this opportunity for a soft launch, a little bit of overlap with our current vendor to where we'll have the chance to kind of pick off calls, if you will, make sure that we have some appropriate, I don't want to say smoke testing, but it essentially is what it is. It lets us work through our SOPs, our procedures, our telephony, all of our tools in a production in a real environment where we're still not responsible for the bulk of this. So it'll help with our nesting program, especially from a training standpoint, to just build that up and make sure that our staff is as ready as possible when we get to that next slide.
Let's pause there. So
Oh, yep, sure.
does that imply that we really wouldn't have enough staffing to functionally be overflow? If we see a huge rise in volume, as I think we would hope coming into 2028 with core verification and everything coming out. I guess maybe I was hoping that this would be more of a possibility of once again, the vendor becomes overwhelmed.
I'm sorry, you're saying at the end of 2027?
Yeah.
Oh, yeah, we could. I think, yes. I think in an ideal state, the vendor, because again, we pay them a significant amount of money to buy the service that we expect.
Could be penalties if they don't.
Sure, DSLAs, all that kind of stuff. Yep. But yeah, I do think we would have that opportunity there if we so chose, make sure that our team members, or excuse me, our Pennsylvanians are as well cared for as possible. But I think, I think there's some conversation to be had there around not maybe expecting that, just in the sense that our current vendor has the responsibility to meet those needs while staffing levels. But as we move forward, so we get out of that kind of soft launch period, And then we take over day-to-day operations again. Like I said, that's that January 3rd, 2028, phone starts ringing, it's Pennie picking up, it's Pennie employees, it's Pennie staff, from there on out. So we're really excited about that chance there. And then I mentioned it before from a metric standpoint, we certainly have a stabilization period. It's gonna be perfect, right? We've got to talk about that from the beginning. I've had that conversation with my team. We had a meeting a few weeks ago where we took a second, we said, okay, let's mourn the perfect implementation because it's not a thing. This way, when it happens and we hit our first obstacle or first road bump, we just kind of adjust and we keep moving because we've already accepted the fact that not everything's gonna be perfect on day one. I think it can be pretty darn good, but that's that whole thing. I think it's Vince Lombardi. I said if we're gonna chase perfection with catch excellence, right? That's what I'm kind of hoping for that we can get to. But again, we have our metrics that we're currently working on to set up and to understand where we're at in 3 and 6 months, so that we can come back and report back to all of you that, hey, these are the metrics we agreed upon. This is where we expect them to be at 3 months, and this is where we are. This is where we expect to be in 6 months. And then again, as I think we'll talk later about potential changes in just a bit about potential changes in open enrollment dates, it's very quickly going to be launch in January of 2028, and then all of a sudden it's going to be the fall. And we're going to need to go through this whole process of ramping up for what is our true first open enrollment where it's just us. So that'll happen very quickly. And that's why those first 3 to 6 months are going to be just as critical as the next 18 and making sure that we're as prepared as possible for OB 2029.
You said we'll have a contingent, like if we don't hire everyone we thought we would, or if the spikes are more dramatic than we thought, do we have a backup contract or something?
I'd say at this moment, I think the answer to that is no, but I will say, Commissioner, that's absolutely part of the conversations that we're having, is understanding, okay, where are our gates, so to speak, of our go, no-go conversations, and then ensuring that we have some sort of a fallback plan. And Rob, I think you and I were talking about fallback plans, really just
Hypothetically,
yesterday.
keep in mind, should the worst case scenario arise, we do have 2 existing option years that we're not exercising for the current. If we were to screen exercise and try to renegotiate that for additional staff, because we saw that there was some understaffing, some issue that we're in. So there are some options that we're not fully exploring yet, but they are on the table should we utilize them.
Does the vendor know you're moving away from it?
I guess just listening to the conversation, I think the other thing that we just have to have the discipline around is the budget piece of it. I mean, I just worry about the trajectory we are seeing right now with enrollment. And what we're doing to manage costs or something like this, and how this, how do we make sure we have the discipline that this does become the, financial savings that we thought it was gonna be, over time.
Absolutely, I think that's fair. I mean, we have to be good stewards of the budget, good steward of the dollars that are coming through. I think one of the, as you pointed out, one of the advantages of going down this path is that we do have a little more flexibility as opposed to being locked into a contract with the vendor. If we do continue to see drops in enrollment, we have the ability to kind of to work through that a little bit and alter the workforces we might need to. And then on the other side as well, if we do see increases in enrollment or find ourselves just in a better opportunity, we'll have the chance to take some of those dollars and perhaps put them into a better quality program or some more technology, to your point, of that's now called. Now we've got even this more slick and user-friendly solution. So I do think I completely understand where you're coming from, and it is a constant kind of reminder of, and I've said it to Rob, we've got to bring this thing on time and on target. That's from a budget standpoint. So very well aware.
And I guess just on the technology side, I would just say too, technology is changing so quickly with, agentic AI, everything. So I want to make sure that where we look, because it is a long trajectory in the grand scheme of things, I guess, or it feels that way at least today. It probably won't as we're hitting up against these dates, but I think we just need to make sure that we are keeping our eye on both of those paths and that we're building for the right future and not just building for what would satisfy Pennsylvanians today, but what's going to satisfy them come 1/1/28.
The goal is to be as dynamic where possible as we can. Because like to your point, if we're using, if we explore agentic AI agents and they look like they're viable, those cost savings, at least from the structure, would go directly to us.
Right.
Rather than getting a fixed price contract where we wouldn't actually see any of this, you know. So we could either choose to have it as a straight saving or to. But in referencing that resource that we've been working with Commonwealth, they're pretty excited as well because we're going to explore tools that none of the other agencies are using right now because there's been so many changes that we've been through. So we are looking at pretty much anything we can to assist for self-service, to assist our agents with, you know, augmented AI, and assisting the CSR offices, the agents, the customers. But yeah, our goal is to be as done possibly.
On our budget point, just everything we talked about today with the number of CSRs, the different levels, all the different knowledge management systems, all the, we modeled various levels of that to come up with the budget number that we proposed and included as part of the approval for this back last year. So we have already done extensive sort of looking at different levels. What if we have a lot of enrollment? What if we have less enrollment? So everything we're mentioning today has already been kind of included and has a number assigned to it in our budget that we're sticking to. So just wanted to make that point as well, of just that we really tried to do a lot of diligence on different potential paths that we would end up on to make sure that we can stick to what we are intending to for it to cost, especially this launching period. I think, again, part of it is still based on enrollment. If we have a lot of enrollment, if enhanced tax credits get extended tomorrow and we, you know, see it pop back up, you know, like, and we have money to invest in more enhanced things in the call center, like that's part of the pro of doing this is that we are able to do that. And then the reverse is true. The federal policies, if we continue to see decline, we're able to make those adjustments and trade-offs directly so that our budget can continuously align to what we're seeing.
Devin, will this be a standing agenda?
Yeah, I mean, I think if certainly intending for it to be, just given how big of a project it is, both strategically and operationally.
I think that was all we had slides. So are there any other questions around the context of finance?
Thank you. Thank you. Rolling over, David.
Thank you. So we're going to transition a little bit to talking about the things that we must do in regards to the federal changes that have come in the law. There was a law that passed last year as well as final rulemaking from last year as well. So the first thing we're going to talk about is a proposed update to our open enrollment dates. So for the fall of this year for 2027 coverage. And then we're going to cover three of the most significant federal changes that are going to be hitting the marketplace. Some coming for next year, some coming from the year after. So we're going to do a deep dive into our preparation. So as you recall, the Marketplace Integrity and Affordability Final Rule that was promulgated last year made the following changes to the open enrollment period requirements starting for open enrollment 2027. So obviously now we've generally always gone November 1st through January 15th. That is no longer an option for us and all the states. So under the final rule, open enrollment can start no later than November 1st and end no later than December 31st. All coverage must begin January 1st of the plan year. So will no longer be February 1st start dates. And open enrollment can be no longer than 9 weeks. So when you look at that, it really hamstrings us quite a bit in terms of what dates can actually do. So with these new requirements, we are proposing to change our open enrollment period dates to begin October 15th and December 15th. When we kind of looked, when we played with the open enrollment dates, you know, this really became, I guess, I would say the most obvious choice for really three reasons. One is this maximizes our enrollment period while avoiding the holiday season. holidays, obviously we see a lot, usually less activity. And so though that period of time, while available to us, we don't feel would actually maximize our ability to reach people. Um, Ending at December 15th also does kind of give us kind of two advantages. One is December 15th always kind of been, that's the deadline for one coverage. It's a very well-known deadline. And then it also gives us buffer time at the end of open enrollment. One, enrollees will get their insurance card, which is always, important. And then, in the past, we've had to extend open enrollment for technical issues or maybe call volume issues. And we would like in having that kind of a period of time where we could kind of address those needs and extend if necessary, while adhering to the new guidelines is very important to us. Yeah, so I think those are three biggest advantages to those updated things.
Do the new guidelines allow for buffer periods?
So
Technically an SCP that where we add time after, so far it does. They didn't, I think they have talked about in rules potentially restricting that, but they haven't at this point.
With the exception of this year, because we already extended for both the 1/1 and the 2/1 deadlines, we've always had broad-based exceptional circumstances that provide people more time if all volume reaches a certain level or wait times are a certain level, things like that. So we would have the flexibility to be able to, at least as of now, add that method. So we did extensive stakeholder feedback solicitation for this proposal. So from November 8th through December 8th, we sought stakeholder feedback from our health and dental insurers, brokers, and assisters. Overall, 107 individuals and entities responded to the survey. Overall, most commenters indicated support for the new deadlines, for the new dates, kind of recognizing the fortunate constraints that we are under. Considerations, and we'll go into this in a little bit more in a little bit, but there were flags regarding operational constraints, a significant overlap with the Medicare open enrollment period, as well as the rate filing process. We also requested feedback on having a window shopping period for October 15th. Feedback was generally positive for that. We've never had a window shopping period. This would give brokers, assisters, and customers the ability to view their plan options before they can enroll. Never had one because you could look at your plans, but you can't really do anything with them. But while feedback was kind of mixed, maybe more positive, us proposing the earlier dates, at least at this point in time, we are not recommending moving forward with the window shopping. So, like I said, wanted to get in a little bit more about the feedback that we got regarding this proposal. I would say that probably the biggest source of feedback that we got was the timing to the rate filing process. And there was concern expressed by insurers that the rate filing process would not allow for an earlier start, and that pushing up enrollment 2 weeks early would make the rate filing, make it more difficult to meet the rate filing deadlines. To kind of address that concern, or to kind of get ahead of it, we coordinated closely with the insurance department to make sure that their timelines, our timelines, can line up in a way that we're not putting a undue kind of hardship on the department or insurers conducting the rate filing with these new open enrollment dates. We did this exercise. I think we all discovered that there is plenty of room within the current filing process to accommodate an earlier OEP start date. And if, if as long as we are kind of all working together towards the same timelines and adhering to them, we really, there shouldn't be an issue with those.
What is,
Joel Hopkins, I would say this is one of the areas that, that Capital Blue Cross, we were extremely concerned about. I hear what you're saying, certainly understand that. I think the cooperation, coordination, commitment amongst Pennie, the insurance department, certainly the insurers, is going to be key here, just to make sure that this happens, because we are. So it leaves very little kind of wiggle room or room. So I think that's key. We're gonna do this.
and I guess in some of the preliminary conversations, like you said, you got stakeholder feedback, things like that. I thought that there would actually be adjustments to the schedule to actually compress them, but the schedule based on our team's review is that there's no real change. There are a couple of dates that change, but they don't substantially change the deadlines and the approval process. Like it's basically the same as previous years. So if we've barely gotten to the finish line in previous years, what are we changing this year that is going to get us to a place where we're able to do everything 2 weeks earlier than before?
No, we just want to jump to the next slide because it has the dates out there, and then we can come back to this one since we're on the date description. I mean, and I think free to weigh in and Rob as well. I think our understanding is that, these are similar to dates in the past. In the past, the date have not necessarily been met. So I think it's like if we collectively are disciplined to these timelines across all the different moving pieces that we have, then we don't necessarily need date changes. It's more sticking to the dates, again, collectively in order to get us that time. I think Commissioner, I know what I'm talking about.
Yeah, no, we've talked through it at the department and we're comfortable with the dates. I mean, there's a couple that were tightened, but the schedule had some buffer in it. So, I mean, in the past, there's been insurers asking for extensions. That would be a challenge. I mean, we're gonna need to go through the process and have kind of the objections responded to on the schedule that we asked for to continue to move together on the time schedule. But I think in an ordinary year, I think last year was a little bit of an exception because of the EPTCs and weather and how and filing two different ways and kind of not knowing up until the last minute. So there was a lot of change kind of there, but I think ordinarily we felt more comfortable and have been able to meet these timelines in advance. So we're not particularly concerned so long as there aren't more significant surprises than I think what we've already seen for this year.
I would echo what Devin and the commissioner said, and also Joel, I think you said it best, that coordination is key here. So communication, coordination throughout this whole process. As you can see from the dates, PID was very open to working with us, and we try to keep the rate filing dates as much the same as possible. So I think it's really making sure we're holding ourselves to those dates, and then we probably shouldn't run into the issues that we've had. One thing worth noting, the network dates, they move up. So the provider network, that's 2 weeks earlier. And then with plan preview, we're looking to shorten it 1 week. So from 4 weeks to 3 weeks. The reason being, we still think that's enough time to really double check the rates in the system, the benefits and service areas, and make sure that those are correct. But otherwise, we still have a little bit of buffer built in for our renewal process to make sure that it's, that we have protection should it be necessary. But we're comfortable with these dates as long as everyone's kind of meeting the deadlines. We don't foresee an issue with meeting the October 15th start date.
Wanted to keep the May 15th date. The networks is easier for you. You submit them quarterly already. So we thought moving up to May 1, and it's a point in time network submission so that you would be able to do that, but keeping the consistency of May 15th rather than trying to move that date up to allow more time in the system. We think that we could still do it by May 15th and get everything that we need to do as part of that process. So we want to give the carriers kind of what they're used to from a starting point versus have you file sooner. there was a concern, I assume from everyone, about having to get those final rates and forms. We were to move that forward, so we tried to keep it where it was.
Good, that's your comments on the schedule aspect, the timing aspect. I think part of the goal also of taking this vote today in February is to kind of have all these dates very clear from the outset. And, you know, to the extent there are adjustments that are needed or just conversations that need to happen across all the organizations, all the insurers involved about what that might mean. I think giving people time to do that. And I think sometimes also like we've gotten a later start on renewals because of like, one insurer coming in late or, and it's a different one every time. Like it's not, you know, I think that's part of the process, especially with the changes in the last year that caused a lot of tumult in that entire process. But we actually, if everyone is in on, you know, by mid-August, it really does give us a good amount of time to make sure we can do the renewal process and get through it. I mean, this year we did 3 renewals because of the changes in the federal policies and kind of all the different pieces that we're shifting there. We normally don't need that much time. So I think it's also, this past year was probably not indicative on a lot of fronts of what it normally takes to do auto renewals. But looking back to prior years, I think we know we need less time than we needed this year for a more regular year. And hopefully with, I mean, given what we've seen in the proposed rule, if there aren't any other federal changes, we're hoping that there's enough certainty to be able to have this year feel more like a normal year, to be able to reach an earlier start date. I'm gonna go back to the others.
Thank you. So some other, I guess, the next one, Medicare open enrollment overlap, there was kind of mixed, some positive, some concerns about that significant overlap. Some brokers kind of indicated that it'd be difficult for them to serve their Medicare population and their ACA marketplace folks. We are kind of hoping that, given that a lot of our enrollees are over the age of 55, that the earlier start times would actually be helpful for people who are working in the Medicare space. And then, you know, I think open enrollment for Medicare is kind of indicative of like, you know, having that certainty of coverage from the beginning of the year. That's kind of something that we're striving to do with this date change. So, you know, we think that, yeah, finalizing the open enrollment period dates now would give, you know, agents and brokers ample time to kind of prepare for the earlier start date.
I think it's a volume question though, right? It's how many people that they have to serve, right? And I think, you know, what we hear in our market, they're taking care of their Medicare people first and getting that out of the way. And then that, once they get that piece of work done, then they're moving on to the consumer population and working with their consumer. It's a bandwidth issue, right? So I don't think.
Sorry.
Go ahead.
And highly unlikely that they're gonna scale up for this. They're gonna
Right.
say, hey, what provides a little bit more in the pocket first. That's just the reality of it.
And I think even if that's the case, like is a lot of self-service, especially we see existing consumers coming in first in every open enrollment. So I think if there is bandwidth and sort of maybe recognizing that they may not be able to shift to marketplace consumers until closer in November, I think still providing the window for consumers to come in and take care of their updating their information and looking at their plan options starting October 15th. Like, I don't know that we should shut that off, waiting for brokers to be ready to handle volume. You know, like, I think we can recognize that they might have volume constraints in October, but still open the door for people to come in and start updating their information themselves.
I just would share that I think most brokers today to wait until 12/8 to push harder on ACA. So I mean, I don't think they're starting in November. I think they're starting.
And if it is November, it's very late November. And you're also back to our previous discussion on call center staffing. There are also models too, where they're shifting over the Medicare staffing to handle call center volume and pivoting it to consumer to help support the peak of consumer. So that's another, as you look at staffing to support the whole ecosystem of open enrollment versus AEP for Medicare, that's another.
And partly, as we think about staffing the contact center too, just 50% of MA sales are in the last 2 weeks. So most of that volume is going to have a bigger impact. So I don't know what that's going to mean for kind of that people who used to go through brokers, I think are going to be potentially forced into now we have months to deal with it, but I don't know that we won't see some impact.
So I think, as one of our earlier slides alluded to, we already have half of our enrollees have a broker. At least for this year, they can be renewed. We'll talk more about that later, but they can be renewed. So that's already a chunk of people that in the brokerage book was already settled. And then, the rest of the time can be focused maybe more on new customers. So, that's always kind of a built-in advantage for them there.
I don't know if we can say they're settled though, right? You can't just assume, like, given how much fifth enrollment we had this year, and as year over year it gets more challenging for people to afford stuff, there may need to be more interaction with somebody to ensure that we get people to actually renew. I don't think we can assume if somebody's with a broker, it's already handled. Broker can't get to that client, like that risk enrollment, I would just say.
Yeah, I think in some ways you make the best of the scenario that we have. We're limited to 9 weeks. Going to the end of December stinks. How many people are in your offices the last week between Christmas and New Year's? Very few. So staffing up a call center, the last day is December 31st. I think that's a challenge. So I think 12/15, and I was initially a 12/31 thought person. And that holidays came through, and it's a challenge to get in touch with anyone. During the holidays, people don't enroll based on Pennie data those last week and a half before the holidays. So I think then you're stuck at 12/15. So the question is, do you maximize the whole 9 weeks or do you cut it shorter? And I don't know why we would cut it shorter. Why would we continue to start on November 1 if we could start earlier and at least be talking to people, letting people go in, those that have a broker or those that are looking for a new broker, gives them an opportunity to find a broker to enroll in. I guess I don't see much option outside of the recommended dates because of the other challenges, both in the federal rule and just the calendar.
Let me just ask one, because I would say I'm also opposed to the 12/31. We see very little volume days. I guess to the extent that we have sometimes seen it extend past 12/15, I'm just asking, was the only option kind of start on 10/15 for one exact week later? Did we talk about other dates in between, or was it kind of it's going to end on 12/15, we're going to end on 12/31?
So I think we did 12/15. I think we wanted to anchor the end dates is something that people are used to, and 12/15 is always kind of like the benchmark of okay, 1/1 coverage, 12/15. All coverage is starting 1/1, and there's in the past we've talked about there's been a desire to keep kind of the 15th of the month rule in place for open enrollment to kind of manage, enrollees who come in at the very end, but right before the deadline, so that they're paid up and they have their insurance cards and they're ready to go 1/1. Biggest concern with going past that. So December 15th is a big anchor. The commissioner's point, we realized pretty early on that November 1st would be the other anchor, right? And that's where I started at. It's we are just go 1/1 to the end of the year. But we run into a lot of logistical challenges doing that. We wanted to stay anchored to get to the 12/15. And if we then started at, November 1st, then we're cutting off 2 weeks.
But
Yeah, and just to-
12/15 also gives you the opportunity, like, clearly based on the volume data that you showed us earlier, there were a lot of calls on 12. We get a lot of calls on 12/15. We can extend out an SEP and it goes until the 22nd versus if we went to the 22nd, then your SEP would be through Christmas and into New Year. Like that's going to be your most challenging time to get people, both from a staff perspective and to get their attention to enroll in coverage. I think that's why 12/15 gives us that extra 1 week of I guess I'd call it a buffer in the event that we needed a special enrollment period at a time that people would actually be accessible.
I think that would be harder, to be honest with you. If you are planning for a 12/31 end, you're staffing to that from the beginning. You're hiring people and telling them they're going to have to work those weeks, as opposed to a last minute SEP where you're then trying to find staffing when you had not planned for it, right? To handle calls, volumes and things like that.
I mean, I think that we'd only trigger that if we had like a.
Yeah, I understand.
technical-
Yeah.
So it's,
Yeah, but I think if we look to the future, if we're sitting here and it's 12/14 and we have 40% of the population that hasn't taken action to go into their account and they're going to lose coverage as of January 1st, what are we going to do? We're going to let them all get terminated because they don't act in that one day? Like, what is that going to look like?
They'd have the SEP over the next week or so. If we ended on 12/15 and the numbers come in, can make up some justification as to why we need the SEP to continue.
But I think then maybe you all could pivot, but I think everyone's then having to pivot to try and figure out staffing in that short time. In the past, because when we've done that, it's not been the holidays, right? You're not, if you at the front end know, and you're hiring people telling them whether, additional staffing or your existing staffing, everybody knows that end date's going to be 12/31 and they're going to have to work through all of that. I think that's different than a week before or 2 weeks before 12/31, then trying to figure out your staffing plan because we've put an SEP into the mix. That's different. In the past, when we've had SEPs, it's been SEPs into not the holiday times. It's been in February or back in the day, April and things like that, right? So,
and I think the challenge now is if we went to 12/31, for example, we wouldn't even be able to extend it all. Like if we had a huge outage on 12/31, we just wouldn't be able to go into.
I thought you said that there could be an SEP.
Because the
No,
federal.
the new rules are saying we can't.
Go past.
I understood. Then I thought when that question was asked earlier, then there could be an SEP. Like if it's an SEP, an SEP can happen. Yes, everything post the open enrollment, right, is an SEP. I guess it would be the differences as to what the reason for the SEP was.
I mean, I think it's because has to stay before 12/31 for 1/1 coverage. So I guess we're reading that as like.
You have an SEP, but it'll be 2/1 coverage. Is that what you're saying?
Which we can't do.
Which we're reading as a restriction in this, that we have to stay before 12/31.
For the 1/1 coverage.
For the
They
1/1.
have an SEP that gets them 2/1 coverage.
Yeah. I guess the other side of this though is we're 11 years into this program and December 15th has been a huge date every single year and consumers are so trained to that. And it took 10 years to train them to that. And so I think like, it's not even just saying you have to work to the end of December 31st. Like our tech vendor, if there's an issue, half of them are on vacation. If there's an outage, like it goes across all, if there's an issue with an insurer, right? Do they have the right person who knows that nuanced thing? Like what are the odds that that person's going to be available to fix that quickly on our busiest days where we have like really no buffer to go into January under our interpretation of the new rules. So I think it's not as easy as just saying like we have to work until 12/31. I think that the whole ecosystem and consumers just don't, like it's like a whole cultural, people shut down between Christmas and New Year's. It's kind of fighting against an entire culture of people checking out for that time. Where we have a date sitting here that consumers know and are trained to, and it's our busiest day every single year because people know that date. And so I think it's trying to lean into what people already know and change as little as possible. Where if we're changing the front end to try to maximize enrollment, keeping the deadline the same, I think has all those benefits to it, as opposed to like a 12/22 or 12/30. I think there would be a lot more confusion around that than just sticking to something that people have been, like we know how hard it is to get messages out to consumers and to train them to a date. And it's been 10 years of training them to December 15th.
I think that all the points that are being made are just such good points. We batted them around as a company and you just can't get past the holidays. I mean, that's where everything comes to a screeching halt. Forced to choose between the lesser of two evils. And I think keeping it open through the holidays, you're just throwing that right out the window.
If there was an
If you didn't make
SCP,
choice.
when would you imagine that you might know if that's likely or not? It'd be more likely we would find something early in the process that would support an SCP.
So the way we've done it in the past, which does not mean we have to do it this way moving forward, is we look at traffic I think it's the 5 days leading up to the last day. And if it's above a certain wait time, or if there's any technical outages, we automatically trigger it. And what we've seen when we've done that is people still come in on December 15th. Like we still see that as the big day. And then we see a huge drop, and then it does help a certain number of people who are trying and didn't get through. It's not major volumes. Even when we have extended it in the past, it's higher than when it's completely closed. But it's not like December 15th just gets shifted out to December 18th. It's people come in December 15th, and then we see people who are not able to get their issue addressed coming back through at sort of a moderate volume for the next couple of days. So in the past, it's really been the days leading up to it. I think we can discuss if there's other triggers we want to have now that we sort of have a different construct. I mean, that's something that we could look at and come back if we want to look at, like, did not enough people come in and act, like for next year, did not enough people log in? Does that trigger something? You know, I think those are things that we can look at, especially looking into next year, if there's other kind of triggering events we want.
Might be worth exploring some opportunities if there were sort of, to your point, 12-15 date is highly communicated. But I think there's a lot going on in both the ACA and Medicare space, and over the next few years, the chance of just increasing shopping on both, I think, is true. Trying to make sure as many people can get coverage.
And we could probably get very creative with the exceptional circumstances. So when you're saying if 40% of people haven't, when we get to pre-renewals, we have to actually do pre-renewal verifications. We could check on a certain date. If a large population of our consumers have not verified, we could then trigger this up then as well, right? Like it could even be, say, November 15th. We're still at 60% haven't verified. But I do think ultimately, obviously this isn't like the ideal solution. I think everyone here would prefer to go 11/1 to 1/15, continue going forward. We don't really have that option. We really have to choose between the two options. Neither is probably the ideal solution. But with pre-renewal verifications on the horizon as well, I think we're trying to think, how do we spread call volume earlier in the year? Like, how do we utilize the pre-renewal verification process to make sure people are updating their account, checking the information that they have available to them? Might not be able to actively shop, but are they still fine with the plan they have? If they come in, they verify their information in August, we can then review them. So we might be able to pull off some of the call volume that we'd otherwise see in open enrollment, because we're going to have much earlier contacts for a longer period of time in multiple months ahead of the open enrollment start date as well. I think we really have to adjust our communication strategies, our customer service strategies, and things like that. Either way, I think it helps us with this type of issue.
Devin, I think your suggestion is a good one. I absolutely would encourage you to look at those triggers and start thinking about that in light of this conversation, because we get up, you know, if we're bumping up against the end, it's going to be common chaos very quickly.
And it's not going to be easy to find that stuff, to the points that we all just made, because if we're not being prepared and staffing for it ahead of time, you're not going to find somebody who's, 3 days before Christmas saying they're willing to work, Christmas Eve,
Call center staffing doesn't become an issue until we take over the call center, right?
I'm talking about even just at the carrier, so it's everywhere, like.
If there's an issue, trigger GI to say, hey,
And just as a general statement, I mean, this one speaks towards extended hours. But from the content, once we have our own internal contact center, we're going to have the ramped up staff through January anyways, because of the 1095 period. We know that open enrollment doesn't just end our volume. That obviously doesn't speak to the insurer side. I don't know if a similar trend exists on the insurer side, but from our perspective, we would still have the ramped up staff. Hours we'd still be expecting New Year's Eve to be regular operating hours. Maybe not extended hours, but at least we'd have regular operating hours if necessary. So with the SEFs, it's the same thing. We would at least have our regular operating hours and have the full staff that we would need. In terms of time off requests, things like that, we'd have to figure out what our policies and procedures would be to make sure we have enough people active on that day and to limit our shrinkage counts. But from just a body count staffing perspective, we should probably be prepared for December because we have to have the staff through January.
Do we know what other states are doing? Like New Jersey, for example?
Jersey already has to 12/31. They already do it today. They've been doing it for years.
And even with that in New Jersey, we still saw December 15th be the most voluminous day. Like we would have another peak on December 31st, but it would it's so ingrained. I think it varies. I mean, the FFM likely to end on December 15th. And don't know for sure how the others.
Yeah, I mean, I would say on the assistant side, that last week is very tough. I mean, no one wants to talk to a Pennie rep out in the community that week, so I think those weeks are hard, but the planning thing too, I mean, we had to black out vacation this year for folks, so advanced planning is always.
One of the Get Insured exchanges actually already uses this time frame. So Idaho has I don't know about always, for at least the past few years, they've been 12/15 or 10/15 through 12/15. So from an operational standpoint, we know that auto renewals are not going to be heavily affected by it because they're already doing this process at this earlier timeline. And then in staffing wise, we can reach out to them about how their contacts and staffing works, but we know that they've successfully been doing it and have been very pleased with that data.
And it was also very heavy broker state. They have even like I think 70% or more of their enrollees are through broker. So that's, I think, Idaho, I mean, already planning on talking to them about this anyways, but Idaho is a good case study. They've been doing this for years. They're always, so.
I think the only question is they're very low in penetration state, so they might not have the same.
I'm sorry, we couldn't hear you down here.
They're a pretty low MA penetration state. So if you have, say, Medigap coverage, you don't shop during the open enrollment period. So they just might not have the same overlap. Not saying it's not a good example, but just the concern is Pennsylvania is one of the most penetrated MA markets. And I think that's why the timing just feel more acute here.
My last thing I'll say, which isn't on the slide, but I know I've talked to Devin about a couple of times, and I know there's an ask today too to increase the marketing budget for Pennie. You're asking to, start the open enrollment 10/15. It's a mid-year election year, and advertising on the political side is going to be insane. So I think your thought was like, well, then we'll wait to advertise until after the elections. But so it's kind of, I want, as far as being, good stewards of the dollars too, and on the marketing side of things, I worry about, we're going to open it up here, but we probably shouldn't be spending dollars in that time frame because the costs are going to be extremely high. Getting the clearance is going to be unlikely because political ads will take precedent. Just putting that out there too from the marketing lens of things. And how are we really going to use that increased marketing budget? Because I would not be in favor of using an increased marketing budget to start that advertising earlier, because I think it's just throwing money to the wind to some extent based on what we're going to face, especially this year with midterm elections.
And I think it's a good point on the marketing strategy side, which we can talk maybe more about when we get to that and pick up that conversation again. On the communication side, I think and I mentioned before that the very consistent pattern we see is right off the bat, it's existing enrollees that come in, and that shifts to more new as we get closer to the deadline. So I think even with election, even if we have marketing at a pretty low level, I think we'll still see a lot of people coming in whenever we send out the auto renewal notices, and that isn't competing with any advertising time. That's just us sending out our notices, our emails, all the things that we have to directly communicate with people. So I think it's a really good point around how we strategize for getting new people in and trying to still have and grow enrollment for next year. I think the good news is that it shouldn't impact our communications with existing enrollees, which we can do directly, not through public communications.
So I'm not a marketing person, but don't we see that same problem as you get closer to the holidays? With advertisement budget?
not as much because you,
The political stuff is.
yeah, political stuff gets, like our stuff would get involved in some cases. Sorry.
Something about that.
I will say from a branding perspective, that was my push, is to stay 12-15 because losing or your enrollment dates are part of your branding as much as penny.com and your phone number. Like that's the other thing that you want people to remember. Penny.com, the phone number, and when the enrollment dates are. So staying at 12-15, at least from my perspective, made the most sense because as Devin mentioned, we're already kind of trained consumers to 12-15. So it would be like, in my mind, changing the website, changing the phone number to move away from 12-15.
While you're talking, if we want to jump ahead to, I think the 2 slides ahead, we're just talking about kind of like the challenge of not having January 15th as the deadline anymore. Not sure if you wanted to.
Yeah. With it always being all the way until, January 15th, having the 12th or the 12-15 being the final one is losing 115 kind of we always saw new and younger enrollees come those later weeks because if insurance is kind of top of mind for you, you're worrying about it earlier in the year. So that is, I know we were talking about the marketing budget a little later, but like getting the message out that there's only one and only deadline is going to be imperative this year. So it's really that it's us trying to get it out early and often, earlier in the year, as soon as we establish whatever the dates are, and making sure that our current enrollees know that. And then we always get the question too from the media of like, well, what's new this year? Well, this past open enrollment, there was a lot of new to talk about. This coming year, it will be those one and only that deadline. So we're going through our plan right now, our communication plan of when we're going to start communicating to enrollees. But what happened through the unwinding, what we saw with the expiring tax credits, that if we can get ahead of the communication before it even starts, that we're going to have a more informed enrollee base. And then a lot of that communication and advertising is trying to reach the actual uninsured. So our enrollees will be a little bit more taken care of. And then really just a call to action there on that last bullet point to have everybody helping to push that final deadline because of the biggest change.
Okay, given the fact that, the majority of stakeholders were in support of us, of our open enrollment date proposal, and our timeline alignment with the insurance department, we recommend moving forward with the new proposed dates for open enrollments. So I mentioned this, but, given that this would be a significant change already, we are not recommending moving forward with the free October 15th window shopping option at this time, but, would potentially revisit in a future year.
This might be an ignorant question for the commercial insurer representatives who are here. Is your open enrollment period also being constrained, or are you still planning to do November 1st through whenever has been done in the past? And the reason I'm asking is if you have this differentiated open enrollment periods, is that going to cause any confusion for the public, even if they're not necessarily qualifying in the same way?
I would say today employers have a lot of opportunity to choose their own open enrollment, so there's not consistency.
I think off exchange ACA coverage is typically aligned to the same dates. So if somebody was to buy off exchange and directly with the carrier,
Okay.
we would align the dates. I mean, I don't know what the rules are, but that's how it's always been. Does anybody know any rules?
And what about our dental insurers? Have they provided feedback?
They were listed in the deck as provided.
So we had, I don't have it right in front of me, but I think we open it up to all health and all dental. The ones that did provide feedback, they were all in support of. I don't think it was all of them, but maybe half.
So I'm looking for a motion to change the dates of the open enrollment period, beginning with the 2027 open enrollment period to start on October 15th and end on December 5th.
This is Tia, I so moved.
He moves. Do we have a second?
I'll second.
Is that Antoinette?
Yep.
Antoinette seconds. Any discussion? All in favor, say aye.
Aye.
Any opposed? Dr. B, I'm gonna assume that was a support, right?
Yes.
Any opposed? Any abstentions? Motion carries unanimously. Thank you. Rolling, is it still David?
Yep.
David, we're still with you.
Okay, well, thank you for that. That gets one major item off of our plate or I guess onto our plate. But now we're going to talk about additional federal eligibility changes of which we don't have any choice in the matter.
As there a quick time check, maybe move this part a little quicker, just running to it a little bit.
Oh, sure. Okay. So since the day the ink was dry on HR 1, or the big beautiful bill act that was passed on July 4th signed into law last year, we have been preparing to implement the new federal requirements. The sum total of this will make it more difficult and more expensive for people to enroll in coverage. But our goal throughout this process is to maximize our ability to retain and add enrollees while achieving compliance with the new law. So we've put together an organizational-wide project team, a couple months ago. We've been meeting continuously ever since. And the biggest changes most significant changes we're looking at right now are one, the pre-renewal verification and pre-enrollment verification. So, pre-renewal verification speaks to the fact that anyone who wants to be renewed into coverage with financial assistance will have to take some kind of action to confirm their eligibility to be renewed with premium tax credits. And we have to have that mechanism in place by no later than August 1st, 2027. And that will impact the 80% or so of our enrollees who currently receive APTCs. That's about 400,000 folks each year. Kind of parcel of that is new pre-enrollment verification requirements. This removes conditional eligibility to enroll in coverage, again, with premium tax credits. This becomes effective January 1st, 2028, but will impact all new enrollees, whether they come in during open enrollment or through a special enrollment period. What's coming soon is changes to eligibility for those immigrants who are lawfully present, who currently have access to APTC. Starting January 1st, 2027, so again, we'll have to implement this during the open enrollment period, is the law removes APTC eligibility for non-citizens except for lawful permanent residents, compact of free association migrants, and Cuban Haitian entrants. So other lawfully present immigration statuses will no longer be eligible for advanced premium tax credits through us. We estimate that this will impact around 27,000 enrollees and cause them to lose APTC. And so that's a significant change that's coming, pretty soon.
David, they'll see it when they log in for coverage during open enrollment, right?
Yeah, so
I know
when
it's
we
not
conduct our eligibility redeterminations, they'll see that their APTC is.
David, this is Amy. Are you able to do you have the granular information on immigration status? Are you able to see who these folks are and who they're not?
So, yeah, so when we ping the Federal Data Services Hub, we get response codes, I think, that indicate each individual's immigration status. And as we can see, that's how we can kind of make that estimate about how many people would lose a BTC as a result of this change. We could see who's currently in eligible status, then who starting next year wouldn't be.
Is their mailing targeted? So on their application, if they have listed they're a lawfully permanent resident, will they get a letter saying, hey, you're not eligible, or will it just be they have to log in and find out?
We'll do it.
Yeah, well.
Okay.
We tend to do that every time. It's a population for like this, but we will do a targeted.
And I'd imagine we'd start it in advance, so it's not shocking.
Will it include, Amy here again, will it include like notices? I mean, like, because the information can be wrong sometimes in the federal hub. And there are also people who are constantly changing it, like, especially if people are becoming LPRs, that could change, the next day.
So our targeted communication would be in advance. So when that's point would be months in advance. They will get specific eligibility determination notices at the point of renewal. They could call in for an escalation or they would feel with, well, should they want to pursue that?
So just as an example, so for this year, a smaller scale of impact, but eligibility for immigrants who are not eligible for Medicaid, but are under 100% FPL, their eligibility for APTC went away this year. We sent them an ad hoc notice emails, letting them know of the change and then kind of what was available, other resources. Actually, we would do something very similar, probably more for this population.
What are the categories of immigrants who are going to lose eligibility? Are these like H-1B visa holders? What are they?
H-1B visa holders, refugees, asylees, God, I'm trying to think of all the different immigration categories, but pretty much, really anyone not in these three specific categories of lawfully present who's eligible. So anyone, on a visa who hasn't had, they'll. So the Cuban entrance, that's very small. Coastal migrants, very small population. The biggest one, permanent residents. But if you haven't been in the United States for 5 years, can't be an LPR. So anyone under that will lose eligibility for tax credits. And honestly, it's kind of for adults right now. That's kind of what the Medicaid standards are, and it'll kind of more aligned with that. So people who currently not eligible for Medicaid, but otherwise income qualify, now they can get a BTC starting next year if they will.
Yes, I think there'll be a slight difference. There's no 5-year bar to the premium tax credits, right?
Right.
Okay, so there will be some people who can't get Medicaid, can continue to get Medicaid.
Right. And then the other one we're tracking is aligning our system to the changes happening in Medicaid, specifically related to community engagement. So also.
And we have timelines on the next page that I think we'll kind of skip through, but those are there for reference on kind of how we're mapping those out over the. I don't know, let's skip it.
So what are we doing to prepare for this most significant changes? We talked about this before, but pre-renewal verification, arguably the most significant change that happened to the Affordable Care Act that's passed. So currently, as we all know, anyone who's still eligible to be renewed with tax credits can be renewed. They don't have to do anything. In fact, most people don't do anything. That's going to change starting in starting for the 2028 plan year. So, this will, in order people to remain eligible for premium tax credits, they will have to come in and provide some sort of affirmation or confirmation that their existing information is correct. And then they will have to have that information, will have to verify the information through trusted data sources. So I guess, so in addition to them having to take a step, some people that we renew now, they have a data matching inconsistency. They're still able to be renewed with APTC. They have 90 days to resolve their data matching issue. But during that time, they have coverage with APTC. That will change starting in 2028. The reason for the emphasis of the pre-renewal verification part is that's coming soon, no later than August 1st. We have to provide a way for people to verify their eligibility by that point. And we're really leaning in towards looking at that period of time as like, okay, we're going to get as many people verified as possible so that then they can move to the renewal and enrollment stage of the process. So then the second part is pre-enrollment verification, so that I guess pre-renewals is for existing customers who are going to have newly taken action in order to be renewed with subsidies for the next plan year. Pre-enrollment verification is for new people who come in who, in order to have access to financial assistance, are going to have to have their information verified prior to having access to financial assistance. So you can enroll in a QHP only, but until all of your information is verified, unlike today, you have to have all your information verified before you can.
One of the challenges we foresee with this is that sometimes you have someone lost a job and is trying to provide documentation for that. It may not be available in that moment. And so right now they could get coverage with tax credits and enroll in a timely way. And while they're verifying that, under this new approach, they would have to either delay enrollment or pay full price. Again, for people who are at lower incomes, the full price is not going to be an option. So it's more of delaying the care until they're able to produce documentation. So this is sort of when we say it makes it more expensive and more barriers to enroll in this way, it's making it more expensive for that upfront enrollment. If you don't have if you're waiting on a document, either from a government entity or from an employer or something to verify some of your information. I think that's one of the challenges we foresee with this is that it could really present a barrier to those new enrollments and kind of impact our new enrollment numbers.
And once their information, if they're missing a document, they have to pay and they're capable of paying for, at least for the month. Is it retroactive, the adjust, so they would get a credit once it occurs?
At least that's our interpretation.
Or that might get reimbursed.
Yes.
Probably information here.
We'll make them.
So they may get more off of future premiums and then eventually.
We still have to,
Okay.
implementation regulations. We evaluate that.
That's
still something to discuss it.
So really, I mean, across all these changes, we are really focused on making these changes in a way that minimizes burden on our customers to enroll and stay enrolled, and make the process as easy and how. So these are some more milestones and effective dates. I'll kind of go quickly through this. We're already, at the period of time where we're developing our preferred approach to the pre-renewal verification piece of this. Because again, 2027 things ramp up there. We have taken on a leadership role with all of the all other full stack insurance states. In terms of we've already convened them, already convened all the states once. We're going to be doing it again in March with our goal of aligning kind of what we want out of this process with all of the states. Insured is going to have to implement their system solutions to fit all of their clients. We are trying to steer all the states in the direction of being as customer friendly as possible so that we can go to our vendor with not just this is what Pennie wants, but this is what all of their clients want. We're hoping that that will lead to better outcomes more quickly. So we've really taken full court press on making these changes and understanding exactly what we want from this. So this right now, we're developing our preferred approach. Later on this year, coming up, summer and fall, we're going to be working with Fincher to finalize a system-based solution. And then really starting 2027, we're going to have to update all of our, the website, policy manual, all of our procedural documents. And then, it's not in here, but we're going to have to communicate, make sure everyone knows that they have to come in, they have to do something in order to be renewed. And then, we're going to try to implement our verification process as early in 2027 as we can, because from our perspective, the earlier that someone can verify their eligibility, the better. So we're looking at kind of the mid next year. We're going to try to beat the August 1st deadline for that. But then by August 1st, we have to have this launched and then have all the consumer communication around it. Similar for the pre-enrollment verification process. They kind of go hand in hand. Our goal is not only in this pre-open enrollment eligibility verification timeline, we're not only going to have it open for current customers to eligibility verified, but we're also going to give new customers the ability to have their eligibility verified. That's one less step they have to take during.
I would just say to the previous discussion, I think we need things after August 1st documented in the project plan to be tracking what's the contingency plan if we're not seeing the results that we need to see as far as the number that people are going in and doing, what they need to do to verify.
Yep, we'll definitely flesh that out. I did want to highlight a major risk here because it'll come back up when we talk about the proposed rule that this was put into law last July. We still don't have guidance from CMS. They keep saying that they're going to put a rule out and guidance. So we are, proactively trying to make sure we can implement this in the most consumer friendly way, which will take time and work from our vendor in order to do that, which is why we're trying to do it so early and stay on top of it. If we come up with our preferred approach that we think minimizes disruption to the consumer as much as possible, and then CMS comes out with a rule that disrupts that, it's going to be very challenging to still meet our goal of trying to make this as minimally. So that's a huge risk here. And, we'll talk about it again. We get to the proposed rule section of sort of highlighting their lack of their promise to provide guidance here, but their lack of guidance so far. But that's a huge risk here. And, I think just wanted to highlight that. Any other questions on the enrollment verification? We did have a break, but we are running a little behind, so I hope we did power through. All right, so next up, I want to talk about the last piece is focusing on affordability. So, as call back to what we saw during open enrollment, some of the highest impacted groups were the lower income, those price sensitive populations, and the full pay individuals who are now above the income cliff, no longer have access to tax credits. That number going